Good morning.
Good morning, ma'am.
Yeah. Good morning, ma'am.
Good morning. I think we have all our students here. So we're waiting for our judges, are we?
Yes, ma'am.
Very nice to see you all. What I would really like is the camera on, microphone off, so that I can have a look at your faces. It's very important to see you while you speak and even otherwise.
Ma'am.
So can we have all the cameras on, please?
Ma'am, we are live now.
Okay, that's no issue. Can we have all the cameras on and muted? We'll let you know when you can unmute yourself. We have one of our judges. Have the others come, Bindu? Good morning, Mrs. Sen. So nice to see you.
Good morning. Good morning. A pleasure. Absolute pleasure.
Yeah, good to be on a digital platform.
Yeah. I mean, you've organized this so well.
That is yet to be said. You'll say it only. We'll say it
had
only
the
after
first
5
round.
p.m.
No, but you had the first round that went off flawlessly. And I'm sure this is going to be fantastic.
Actually, you people pitched in also quite a bit. Everybody pitched in, but and actually what I feel happy about is that you've come forward with your support, you know, and in your enthusiasm to participate. If this goes on, then I think we can do it in a big way for the next few months.
It's actually wonderful to see the children also, you know, express themselves and the enthusiasm of the children. And, you know, the way they speak, and you get to learn so much from them.
Exactly.
It sort of takes you a step forward. Every time you hear them, it takes you a step forward.
That's true. Mrs. Das says that their electricity has gone and she's on a hotspot, so she won't be visible, but she will be there. So I'm just finding out if she has joined. Has ma'am joined?
Ma'am, I can hear you, but the video will not play because it will keep buffering.
Okay, that's okay. But you're here, aren't you?
I'm here.
So
I'm here.
Waiting for. Thank you. Good morning.
Good morning, ma'am.
So now we have Dr. Ivy Dhar to come in. Oh, she's there.
Good, good morning.
Good. So I think we'll start, and we have our chief guest joining in. So when he comes in between two kids, we might just give a little break and introduce him. Is that okay? Because I don't think we should delay. We should start.
Yes, ma'am.
Absolutely.
What about you, Dr. Chaudhary? Shall we start?
Yeah, absolutely. I'm looking forward.
Okay.
And a warm welcome to everybody. Yeah, hi. Absolutely pleasure to meet you, Sonali. And Ashrita.
Well, it's actually an honor to be here, and I've been looking forward to this.
Great.
You all do such good work, and I keep reading your, you know, your write-ups whenever possible. And it really has made a big difference.
Thank you so much. Mr. Chandrajit has joined. Yeah.
Has he?
Yeah. Yes. He's having some connectivity problem, but that's
very good. Good morning. Thank you. All the way from. See, this is the advantage of a digital world. So we have someone from Andamans also joining in with us. So we are not going to wait anymore. We'll start. First of all, good morning, all of you. And it's a pleasure to see you here. And thank you, the judges. Thank you, Mr. Banerjee, for joining in to hear the children. So I'll give a very brief the introduction of hope, before we start, because some of you know, but some of you may not. So we hope stands for Health-Oriented Programs and Education Initiative. It's a not-for-profit organization started by Dr. Chaudhary because he felt at that point of time in 2004 that health was not given enough importance in the curriculum of the schools, which is justified. We never thought of health in such a big way as we think of it now. So all our topics pertaining to nutrition, sanitation, hygiene, bullying, ragging, global environment awareness, we all started discussing with the children way back in 2004 when it was really not given much importance in school. But there was a difference in our method. That is, we didn't give lectures or whole classes. What we did was, it was a fun learn way of getting aware. We had movies, we had quizzes, we had painting competitions, we had debates, of which you are going to be a witness today. We had skits, and through these, there was a message which we wanted to send across to the children, and through the children to the community, because we felt that the children would convey to their elders and through them to the rest of the community. I must say we did pretty well, and I'm very proud of the work that we have done. And our team has been extremely sincere and dedicated. Last 2 years, pandemic has threw us a little off guard, because just as you children had to switch to online learning and the teachers had to switch to online teaching, so we also had to, move on to online platform and again reconnect with the students. We have done, but I cannot say I'm very satisfied with how much we have done. But let's see. Now we are trying to make a hybrid system of doing some offline, and our major events would be online, because online, the advantages, outreach is a lot. You can really reach out to people. Problem with online is you often don't get across the message as well. Offline is very good because you have a one-to-one communication with the students and the teachers. But again, your outreach is very, very limited because there's a financial crunch, there's a manpower crunch. So, by now, we deal with health awareness of children, with the children. We do programs on health awareness with the children and try to make them more responsible citizens of the future. Hope so far, just to give it to you in numbers, we have worked in around 17,000 schools in Uttar Pradesh, Delhi NCR from 2014. And we have tried to reach out to states like Gujarat, Rajasthan, West Bengal, Assam, and down south in Tamil Nadu. There is plenty more to do. Let's see, if God is with us, I'm sure we can go further. So this is about hope. And for all of you, I would like to welcome Mr. Banerjee. He's the chief guest of our morning show today. He is the Director General of Confederation of Indian Industries, and he's been in various advisory posts of the government. So we brought him in here to basically to show him what we are trying to do and what we are trying to reach across to the students and the society. And he is a man who is very interested in the education and the cultural part of the growth of the students. So maybe we can have a long association with him, not only as a friend, but also as a part of hope. Thank you, Mr. Banerjee, for joining us. We've disturbed his holiday schedule, for which I'm very grateful you're here. So would like to, if you could say a few words, and we won't hold you very long.
Thank you. Thank you very much, Mrs. Arundhati Chaudhary. I first of all like to start by really complimenting Hope and the tremendous work that Hope has been doing over the last few years. I heard from you briefly about the coverage, and it's indeed very, very motivating. And for me, it's always good to be in such a session, especially with the future of India, if I can say, who are so much very strongly present over here and from whom there is so much more to learn. And my biggest learning comes from the type of people that we have in this video conference today. And thank you also to Dr. Gurdas Chaudhary for asking to be present here today. You know, just as I congratulate you and compliment Hope Initiative for having organized this competition, I think this debate, which is just the right way to involve young minds, young people in issues which are of social, economic, and national importance, is extremely, extremely pertinent. I have two priorities that in my mind, as I work in my institution and through my institution for the country. And those two priorities, the most important priorities in my mind, are healthcare and education. My colleagues who work with me know that that happens to be a top of my agenda. And this program sort of dovetails both these priorities of mine. And so I'm so pleased to be here. Our young friends especially, and I find also many states participating, which is a very, very important aspect of this program. But having said that, I just wanted to say, you know, like all of us have learned in school, AD and BC, what I see now happening is a BC and a DC and a AC. A BC was a before COVID, and DC was a during COVID, and AC is an after COVID world. And at this point in time, my feeling is that we are transiting from a during COVID to an after COVID world. Sure. And we've talked also of a new normal or normal of a different kind, which will emerge in the AC world, which is the after COVID world. But my understanding is that we are entering into a never normal world. So that's something that we all probably need to keep in mind. And it's this young minds and this huge energy that we have in this video conference will help us navigate through the never normal world, is what I believe in. And the topic of today's debate, which is vaccination against COVID, is really the only prerequisite, if I can say, for safe line of return to offline schooling under the present times. And it is, of course, very apt, as I made, and to me, it is a statement, a fact that must be accepted without any debate, of course. But of course, challenging young minds to debate on this and discuss issues as we are, such as this, really helps us tremendously. You know, since today is the final round of your debate, I'm sure there will be some students who will be speaking on different aspects of what is coming up. But just a couple of points in this, as we have been, I've been personally involved also in this subject in certain ways. As we all know, schools have been closed since March 2020, and even though classes shifted to online mode, but pretty much soon thereafter, there is nothing which can replace learning in the classroom, is what I believe. While there has been many good type of learnings that we have had from COVID, this entire COVID has taught us to be getting together in this video conference mode. But the touch and feel of sitting down across the table, especially with people you do not know, etc., those matters a lot. And other than doctors who worked phenomenally, relentlessly throughout the pandemic and are still doing so, it has been our teachers who have actually contributed to nation building, if I can say, in the most noble manner, by ensuring that learning continued in some form or the other, through whatever means possible, be it was it phones, it was tablets, it was laptops, it was radio, television. Phenomenal achievement, if I can say. But the fact is that the online learning was probably in many cases not equally accessible to all our children. And I have personally faced many young kids who didn't get access. Somewhere it was a challenge of devices, and somewhere it was the issue of connectivity, and also, of course, as you know, network. So if I can say, the learning loss in these 18 months has been just enormous, and it will have far-reaching repercussions as we go along. And apart from the learning loss, there was impact on social and emotional well-being. Many of you have heard about it. the mental well-being of our young minds, as they were, cooped up for months like everyone else in their own homes, and there was no peer-to-peer learning for a pretty long time. And the loss of the physical activity, which has been a big concern for me, to be able to go out on the swings, have a good run, and just play hide and seek. Probably the absence of all this led to various types of health issues in our children. And obesity has been one of the things that we have been getting reports about, increased obesity, and so also in certain cases issues of mental challenges and anxiety. So these have been some of the indirect hits of the COVID, which when I have been talking to our system, our network, this came up. So from my mind, it's been good that schools have started resuming classes, and we've got many applications from many schools, many requests from our school boards, from our school committees, etc., requesting us to see if we could work with the government and request the government for resuming classes in a staggered manner. Soon, I hope more states will announce a resumption of classrooms activity with precautions, of course. And when schools do reopen, it is important that they do not, I personally very strongly feel, do not push children to catch up on the curriculum, because I feel it's essential that they first catch up on the basic reading, writing, arithmetic skills, and more importantly, the bonding. So we are sort of running from, and I would like to work with the Hope Foundation on this, running a catch-up campaign where everywhere to sensitize schools that they must not push children too soon into full-fledged activity once they are back in schools. What's important, I feel, is to devote adequate time every day, brush up the previous lessons, previous learnings, because many of these powerful young minds that we have here today would have totally, been challenged within the last 2 years. So talking really of reopening brings me, I must talk about something which comes to my mind at this point. In addition to vacation of all teachers and all support staffs, you have say, for instance, even the bus drivers. It is very important to keep safety points in mind, like sanitation, masks, social distancing, all of that which we have learned in the last 1 year. In fact, we have created something called an SMS campaign, SMS. We call it, to emphasize on these three things: sanitation, mask, and social distancing. And there can be no public activity without these three things in place. And this is very much true for our education institutions like schools. And schools will also have to follow all of these drills with phenomenal rigor, if I can say, caution. And there are no laxity in frequent, there can never be laxity in frequent sanitization of all our surfaces in the schools, proper use of masks by all, and making, of course, sort of marking of adequate gaps between seats and assembly areas where large number of our students are expected to participate. So there are many things, and I'm sure all of this is going on. The system of rotation of students will also have to be created so that all students are not present at the same time in the school. It's a huge amount of work on the administration of the schools, the school administration, the school teachers, and all of them. And it's a lot of work for them too. And but all of this will really ensure that we are able to give best to our children, and they will have to create all these mechanisms with the system that they have. So I do not wish to take further time, but only say that this debate is of great interest to me and to my institution, and through my institution, so that I can spread it into the industry, if I can talk to our states, to our policymakers, to see the type of interesting inputs that will come from this debate. And we assure you that we young minds, especially my young friends, I wanted to tell you that your points are so important to me, to us. We will carry them forward for further discussions and for further debate. With that, I'd like once again very warmly and very sincerely thank my two very good friends, and they come from a community which has really helped our lives. The doctor community and the Dr. Gurdas Chaudhary, who is present over here. And I must also compliment Arundhati for the phenomenal work that she has done on hope. And I look forward to continuing my as well as my institution's engagement with the Hope Foundation. So thank you very much once again for giving me the opportunity.
Thank you so much, Mr. Banerjee. We really look forward to your friendship and your good suggestions for our organization. I think we should move on with the introduction of judges. I would just like to mention over here that the founder and the main kingpin of Hope Initiative is here, Dr. Gurdas Chaudhary. It's his baby primarily, which I helped to execute. So we will have him with his witty comments for your rebuttal round. And he loves engaging with students, young minds. So we will reserve him for the latter part of your debate. Okay, because he can then take down all the points.
Yeah. Can I just make 2 points? I won't take more than 30 seconds. One is, of course, it's my pleasant duty to thank Dr. Chandrajit Banerjee. He has been an erudite student, an economist, and he is also a PhD. And he has been a contributor to a lot of government policies, both nationally and internationally. And people like him need to also engage in health policy and education policy. So thank you so much, Dr. Chandrajit, for joining from, I think you're in Andamans at the moment. So my apologies to your wife for dragging you out of your holiday. Thank you so much. And you know, for the students, I have 1 point to say. What you are going to hear from Dr. Chandrajit or myself or others is what you hear on the national debate. That is, you know, doctors, policymakers, educationists, you know, so they give their views. When it comes to going back to school, who is going back to school? It's the students. And that's the reason why it's very, very important to hear your views. Because, you know, you can't be going back to school feeling like, you know, lambs being taken to a slaughterhouse, for instance. So the ambience has to be good if the learning has to serve its purpose. And, you know, COVID numbers have come down, but they're not gone yet. Vaccination has proved to be useful, but it hasn't yet come down to the level of school-going children yet. So we are still in a bit of a mix. And, you know, we want to hear your candid views as to what you suggest is the way forward. No doubt that, you know, going back to offline education is a must if life has to go on. And we are all waiting for it. But when is the right time and how to go about it is what we want to hear from you and your candid views. The third, I would be failing in my duty if I didn't acknowledge the fact that Dr. Ashrita Das is here as a judge. And she's the principal of Lamartiniere Girls' School in Lucknow. And that is one of the schools where we started our program in 2004. So Ashrita, welcome. With that, we go ahead with the debate. And
thank you so much.
And students, be very candid about your views. Nobody is going to fail you or pass you here. We just want to listen to you so that we can help the authorities take better decisions. Thank you so much. Arundhati, over to you.
Thank you. So I'll go down to the second part of this program this morning with an introduction of our judges. We have 3 judges with us, and they are all in the field of education, and they are all dealing with students. So it's very appropriate that they be here. I'd like to first introduce Mrs. Sonali Sen. She has been, incidentally, she's been a contemporary of mine also, and she's the principal of GPS Newtown, Kolkata. She first started her professional career from St. Xavier's College in Kolkata, and then moved on to Delhi, and she worked in various eminent schools. Ultimately, I think her last one was Sanskriti International in Delhi. Mrs. Sen is extremely positive and dynamic in her attitude, which actually has drawn me to her, and she is very, very enthusiastic about empowering her children with life skill classes with her teachers and her students. And she reaches out to the underprivileged section of the society and believes in a very holistic form of education. I've been in touch with her regarding hope, and I've seen her enthusiasm by way she has come forward in making her children participate or giving her very, very positive suggestions. And I think she's a very important person today. Thank you, Mrs. Sen, for joining. It's a pleasure
Thank
to
you
have
so much
with
for
us.
those kind words. It is indeed a pleasure being here, and I'm waiting to hear these children speak.
Yeah, I think we are all waiting. Shouldn't take up too much time now. Next, as Dr. Chaudhary said, Mrs. Ashita Das, Dr. Ashita Das, welcome today. As he said, we started with Lamatinia Girls College in 2004. And at that time, I think it was Mrs. Abraham, who was the principal of Lamatinia Girls College, her mother, and she provided us immense support. Now, Lamatinia is a very, very prominent school of Lucknow, and their girls, by a personal, I mean, what I've seen of them, they are very, very independent, self-reliant, they speak out their mind, and Lamatinia really believes in empowering the girls with all that is required of the modern society. Now, it's the only school in UP which has trained every teacher in online teaching. I think that is fantastic because our teachers have had to face a lot of difficulty when they suddenly switched over to online teaching last year. Thank you very much, Ashita. She's got numerous awards to her
Thank
credit.
you so much, ma'am. Thank you.
And it's a pleasure to have you here. And I hope you enjoy this session as much as we do. Last but not the least, we have with us Dr. Ivy Dhar. She is the assistant professor of Dr. B.R. Ambedkar University. She is also in the line of education. Welcome, Dr. Ivy. I hope you have a very interesting session over here. And she has been the fellow at the Center of Contemporary Studies in Nehru Memorial Museum and Library in Delhi. I'm sure we'll get a lot of positive inputs from you, not only we, the children over here. And as Dr. Chaudhary said, I think it's you kids who are the main, the main actors of today's drama. So come out with whatever you feel. Don't go by winning or losing. I would say speak out your mind. Whatever you feel, if you feel it for it very passionately, it comes out very well. Now,
Thank you very much for inviting me, and it's a pleasure to be here.
Thank you.
Thank you.
I hope you'll enjoy our session also. Now I'll hand over the mic to Sadhbari. She'll speak out the rules and regulations. One thing I've been insisting on, if your connectivity is okay, please keep your videos on, mute yourselves, and we would like to see your faces. We are being live streamed and it's very nice to look at you. And because this digital platform, for all its positive things, it's a remote way of communicating, and when the videos are switched off, it becomes even more remote. So let's have the videos on and mute our microphones. Sadhbari, over to you.
Thank you, ma'am. Good morning, everyone. Now, students and judges, everyone, we have sent the list to all of you yesterday only. So I think students, you know that your serial number when your turn will come. So as soon as your name will be called out, you will see a screen in front of you. The screen will have certain numbers. You have to choose one of the numbers, and whatever number you choose, accordingly you will get for or against. And we have, as we have already told you before, that you have to prepare both for the motion and against the motion. So you will start immediately after this. And as you all know that we have 3 minutes time, you have 3 minutes time to speak. After 2 minutes, 30 seconds, a warning bell will be there. You'll be able to hear. And after 3 minutes, if you continue, you may continue, but your marks may be deducted. So I hope it is clear to all of you, all the students. And since you all are very well prepared and you have done extremely well in the second round, so we are hoping to hear a very good debate from you all. So welcome all the children. Now we can start. the debate. Is it
1 minute? I think I forgot to announce about the prizes. So
Okay.
we have about 9 states over here, and we have 9 states and participants. So what we have decided is first, second, third on a national level, and then have regional winners from all the states. So we are going to try and give you some very good prizes, which I shall announce maybe during the course of this program today. So that will keep you alert. And that was one. I think we can start now, Sadhbari. Let's go on to the first student.
Yeah. So we will start right now. Our first participant is Anumegha Chakrabarti. Anumegha Chakrabarti.
Yes, ma'am. Good morning.
Yeah. Just wait for the screen. It will come in front of you. You may choose one of the numbers.
1.
1, Bindu, 1. So you have to speak against the motion. You may start. All the best.
Good morning. I am Anumegha Chakravarti from Delhi Public School, Newtown, Kolkata, and I would like to express my opinions against the topic. In the past 1.5 years, as we navigated the COVID pandemic, we have all become increasingly conscious about our health and that of our loved ones, which leads us to the question whether or not vaccination against COVID is the only prerequisite for Safeline return to offline schooling under present times. A holistic approach to education that addresses students' learning, social and emotional needs is crucial, especially in times of crisis. School closures related to the current COVID-19 pandemic means that students from different backgrounds who are more at risk of increased vulnerability are less likely to receive the support and extra services they need. Vulnerable students might, however, have little access to the digital pedagogical tools used for online education and require further attention and support. Closures can also have considerable effects on students' sense of belonging to schools, their feelings of self-worth, as well as their physical health, which are key for inclusion in education. The daily rise in new coronavirus infections has been low, below 30,000 for 36 straight days, and less than 50,000 daily new cases have been reported for 125 consecutive days now. The active cases comprise only 0.47% of the total infections, the lowest since March 2020, while the national COVID-19 recovery rate was 98.19 per second. The daily positivity rate was recorded at 1.22 per second, which has been less than 2% for the last 26 days. So although SARS-CoV-2 virus can cause COVID-19 in school-age children, deaths in children due to COVID-19 are incredibly rare in comparison to more than 200,000 overall deaths all over the world. Moreover, schools reopening does not necessarily mean a return to education as it was before. Other measures may also be put in place, like staggering lunch breaks, limiting face-to-face contact between staff and parents and students, and regular hand-washing breaks. Thus, we have good reason to start offline schooling again, even if students have not been vaccinated against the virus, to make up for the loss in education over the last 2 years. Thank you.
Hello.
Her timing, Shipra? I can't hear you.
2 minutes, something she's saying. It's not audible. It's okay. It's less than 3 minutes. So,
Okay. So go on to the next.
Rajveer Das. Rajveer Das.
Yes, ma'am.
Just wait. Yeah.
Ma'am, 3.
3.
Right.
So Rajveer will speak for the motion. All the best.
All right.
Good morning, respected judges and fellow participants. This is Rajvi Das from Don Bosco School, Silchar, Assam, and I'll be speaking for the motion. COVID-19, coronavirus disease of 2019. This little virus here is a life changer. This has ruined the lives of millions of people. Yet, thanks to our scientists, since the time vaccinations have been launched, the chances of getting affected by the virus have decreased drastically. But we know that children below the age of 18 years are still not vaccinated. So should we risk their lives by sending them to school? Is it like that we cannot study from our homes? I'd like to remind everybody that we are in the 21st century at a time where technology is highly advanced. And this is how we get online learning, which had been great. Now, for sure, many of you might disagree for reasons like headache, muscle spasms, rigidity, obesity. So I'd like to ask, is headache more dangerous than getting affected by a deadly virus? Next comes rigidity, lethargy, spasms. You all say this as if we came to school for working out previously. All these factors are really minor when compared to getting affected by COVID. It is really important to note that everything has its advantages as well as disadvantages and risks. But we have a choice here, and we must choose the one which has lesser risks. And in this case, it is for sure staying at home, because we must remember that health is wealth. Practically, I'm being very specific. Why should we take the risk of sending children to school when online learning is possible? All we need is some time and patience. India will soon be vaccinated with 100% of its population. 73% is done, which means that only 27% is left to be vaccinated. Even if the children from 7 to 12 years and above will be vaccinated as assured by the government, it will take time for the immunization of our body and the vaccine to perform and function aptly. Till then, all we need is cooperation. Children are requested to be patient for some time. We need them to learn to adjust because, as we know, the Hindi proverb goes, "Sabar ka phal meetha hota hai." Once we are all vaccinated, nobody on earth can stop children from going to school. Thank you.
Is it 2 minutes, 25 seconds, you said? Okay, thank you. Next participant, Ruman Habib.
Yes, ma'am.
Yeah.
2. All right. May I start? All right. Greetings, everyone. The topic under fire for today's debate states that vaccination against COVID is the only prerequisite for Safeline return to offline schooling under present times. And I, Ruman Habib, stand here firmly opposing the motion. So let me start off by explaining what the key terms here actually mean. Vaccination is a simple and safe, effective treatment to produce immunity against a disease. COVID, as we already know, is a highly contagious and life-threatening disease which has been wreaking havoc in our daily lives since the past 18 months now. And prerequisite means a thing that is required as a prior condition for something else to happen or to exist. And Safeline, which is the last keyword here, means something designed to return to a safe condition in the event of a failure or malfunction. So let's understand why the motion today stands false. Let me just emphasize on the one keyword which I did not emphasize this yet only. Vaccination against COVID is the only prerequisite for Safeline return to offline schools under present times. Now, let me just ask you, is vaccine the only prerequisite? Is it the only thing that is saving lives? Firstly, vaccines were just developed a couple of months ago, but even last year when we had COVID, we did go back to school. We did return to normal life to an extent. Did we have vaccines at that time? No, we did not, because we had things like masks, social distancing, and all these plethora of things. So, firstly, vaccines aren't the only prerequisite as the motion today states. It is not the only prerequisite. Firstly, because it was developed just a couple of months ago and we had safe life previously last year with the help of masks, social distancing. Secondly, a lot of people do not have access to vaccines. The government of India is trying its best to make sure that each and every citizen does get its shot of vaccine. But then again, tell me, how is it possible that a government can provide vaccines to 1.3 billion people? We have to look at that perspective as well. It's not easy for the government to produce that amount of vaccine, because we do have to export it and help out the other countries as well, which are suffering. And then lastly, my third point being, vaccines aren't available to students. We students are under 18 years old. So even if, for the sake of argument, let's take a hypothetical situation. If vaccines were the only prerequisite for Safeline's return to schools, did we have it? Did our students, people below 18 years of age, did we have access to vaccines? No, we did not. So then again, the motion does not stand true. How is vaccine the only prerequisite for Safeline return to school if they aren't even available to us? And with these 3 points in mind, I think all of us will agree to this thing, that vaccines aren't the only prerequisite. Perhaps one of the very essential, very important very important part for us to be safe, but definitely not the only prerequisite. And with that, I'm very, very proud to oppose the motion. Thank you so much.
Thank you, Ruman. Two minutes, 30. 19 seconds. Okay. Thank you, Shipra. Simon Sharma.
Yes, ma'am.
Yeah.
I would like to pick the number 14.
Against the motion. Simon will speak against the motion. Please start.
Yes, ma'am. Good morning to all the esteemed judges present here. Today, I, Saman Sharma, studying in 9th grade in Ivyville School, Jalandhar, Punjab, would like to speak against the motion. I would like to begin with the fact that most kids are not eligible for any of the provided vaccines and should not be made eligible, as COVID vaccines have resulted in some patients receiving more serious and long-lasting side effects without a proper medical predisposition. About 1 in 100,000 people receiving the AstraZeneca COVID vaccine have experienced a clotting disorder known as thrombotic thrombocytopenia, including 79 cases among more than 20 million people receiving this vaccine in the United Kingdom and 19 deaths. Even if made mandatory, an entire family might not be the prioritized recipients of the vaccine. So if it were the only prerequisite, students will most likely contract the dormant virus on their clothing or even their skin. And as soon as they reach home, they will infect the at-risk family members, escalating symptoms, not just in the grandparents, but healthy parents as well. Especially if they contract the Delta or the other new strains, and the densely populated institutes such as schools, the virus will have more hosts for it to mutate and spread. Studies done in July and August of this year have shown more parents are unwilling to vaccinate their children and ask the schools to not mandate vaccinations for attendance. While on the other hand, more parents support the requirement for masks for unvaccinated children and staff due to the unpredictable side effects the approved vaccines have shown in some people. In addition, clinical trials for any of the 7 WHO approved vaccines at present haven't had a long time to form an exact result on what its long-term side effects are on developing children. The vaccine's harm-benefit profile may be suboptimal in kids. The last consideration I offer is that we do not know if a vaccine will have a favorable risk-benefit profile, gain FDA approval, and be palatable to parents. Consider what might happen to 1 million kids who receive a vaccine that works as well in kids as it does in adults with comparable side effects. At the same time, assume the vaccine has side effects comparable to adults for the second Moderna dose in adults. In that scenario, 45,000 kids will develop severe headaches requiring analgesics and interfering with daily living. 14,000 will have a fever higher than 104 degrees for less than a day, and 880 will have this fever for more than a day. This happens not because these side effects are more common, they are rare, but because you have to vaccinate 1 million kids to save one life. The COVID-19 pandemic has harmed children, not because they have fallen ill from the virus for the most part, but by the choices society has made to protect adults who are vastly more likely to suffer from the disease. In many places, kids have already lost a year of school, development, and life. A vaccine for kids will not happen in the short term, and emergency regulatory pathways for one or more of them may not be appropriate. The risk and benefit will need scrutiny. I would like to say that I am not an anti-vaxxer. I just think we should wait and see the effects of the vaccine before endangering millions of lives just to go back to school when online school is already an option. Thank you.
It's 3 minutes, 23 seconds.
Payoja Sachin Ostwal.
Yes, ma'am. The number 20.
Sorry, please be louder.
20, yeah.
Against the motion, Payoja, all the best.
Thank you. So I'm Payoja Ostwal and I'll be speaking against the notion. The decision of our present are the architects of our future. Since the onset of the lockdown, 157 crore learners have been affected worldwide. Students have been compelled to access digital means to continue their studies. We have gone from sharing tiffins and gossips to staring at laptop screens with staining eyes. Students are facing immense problems related to physical and mental health. According to a survey carried out by the Indian Psychiatry Society, there was a 20% rise in the number of cases of mental illnesses at the end of March 2020. Another grave problem India faces is that access to digital learning is limited. A survey suggests that more than 2.9 crore people in India have no access to digital learning. According to the NCRT survey, 27% of students cannot attend online classes. People living in rural areas have no access to the internet and adequate facilities. How are these students coping up with the school closures? It is not easy to attend schools online. You might expect things around to be like a school campus, but at home, things are different. Numerous things may distract concentration. A study suggests, on average, over a third of the class time was spent on internet in activities not related to the class. This will not help students in their studies. We have been talking about online schools and classes, but what about exams? Exams are not held as they should. Postponement of exams has resulted in pressure and anxiety and additional stress among students. Online exams have reduced productivity. Well, we may argue that the grades have gone up, but 73% of students were found to cheat during online examinations. This is an immense number. Cheating will not only result in the degradation of knowledge, but will also demotivate the students who have put their heart and soul into studies. The advantages of online classes are getting suppressed by the challenges faced during the process of learning. There is no doubt about it. COVID-19 presents a significant hurdle for education. However, as we have seen time and again throughout history, our teachers and youth have been resilient, willing to grow out of the darkest times. We should work in support of them and take the essential steps to open schools.
Payoja, are you finished? Have you finished?
Yes,
okay.
ma'am.
Okay. Thank you. Thank you. Jia Singh.
Yes, ma'am. Ma'am, number 5.
speak for the motion. You may start.
Okay, ma'am. Good morning to all of you. I am Jia Singh from RPS International School, Gurugram. And today I am here to speak for the motion. As per the topic, vaccination is the only precautionized to Safeline return to school. And it is true. And if we take example to understand this, New York in the New York on 15 December 2020, the COVID-19 pandemic has wreaked havoc on children's education. Around the globe, vaccinating teachers is a critical step towards putting it back on track. At their peak in late April 2020, nationwide school closure disrupted the learning of almost 90% of students worldwide. While that number has dropped since, there continues to be an unsupported assumption that closing schools may slow the spread of the disease, despite increasing evidence that schools are not main driver of community transmission. As a result, as cases are skyrocketing in many countries around the world, communities are again closing schools. As of 1 December, classrooms are closed for nearly 1 in 5 school children globally, or 320 million children. And after, when all the teachers are got vaccinated, the schools got opened in whole world. But still present are not sending their children to school because they're all right on their side, because children are still not vaccinated and COVID more spread in children and very fastly. And schools are still conducting online classes. So the parents, those who don't want to send their children to school, they can do this because COVID is very dangerous and we can't take any risk. If there is online classes, we can take online classes. Thank you.
Thank you, Jia. Shipra, the time? 2 minutes. 2 minutes, 9 seconds. Right. Now, Anshika Sinha is the next participant. Anshika Sinha.
I shall choose the number 9.
Number 9.
Yes, ma'am.
Okay. Anshika will speak against the motion. You may start.
Okay, ma'am. So, good morning to one and all present here today. My name is Anshika Sinha, and I'm from DPS, Bokaro City, Jharkhand. And I shall speak against the topic whether
If I may just interrupt, Anshika, could you be a little louder, please?
Sure, ma'am. Okay, and I shall speak against the topic whether vaccination against COVID is the only prerequisite for Safeline return to offline schooling under the present time. So we can't tell for sure that what's in the vaccine, as it could be dangerous for children. And we all know that children are the future of the country. So we need to make sure that the vaccine that will be given to the children below the age of 18 are very kid friendly. Also, it's obvious that school-going kids are below the age of 18. Hence, they don't have the ability to get the vaccine right now because our government can't acquire vaccines for them. Now, the vaccines have been proven functional throughout the decades, and even though the COVID vaccine shows positive impact, we don't know what will happen in the next 5 to 10 years, so we can't compare the two. The vaccines are not completely persistent, and it's not a life or death situation for kids to be at school. We all know that exams can be held online, and even though we have the fear of kids cheating these days, there are many technologies available to make sure this doesn't happen. Now, to elaborate on this, we can reduce the timing for the exam, increase the number of questions, and even request the children to screen record their devices, which is pretty simple and easy. Now, we all know a student's life is worth more than going to school and risking them dying, not to sound so morbid. Now, kids, you might say that the kids might lose the social skills and might not be able to interact properly once COVID is over. Now, to make sure this doesn't happen, we can make sure that there is optimum interactions during online classes by making sure there are interactive games that really invests everyone into it. Now, we all know that the COVID situation isn't going to last forever because somehow, someday, the science is going to prove that the vaccines are 100% safe for everyone. And in the next 3 to 4 years, I hope so, students will be back to school. Now, to ask some important questions to everyone to support my motion is that how can you tell kids to get vaccines even though we don't know definitely what's in the vaccine? The second question I have is that for these past year, we know that the vaccine has been given to adults, and suddenly the government is talking about giving the vaccines to kids. So, what made them think that this vaccine is safe for kids now? The third question I have is even if schools do open and everyone goes to school, and if there are cases going on in the class and children still get COVID, there'll be major lawsuits for the school because we endangered a child's life. So we need to make sure these questions are answered. Thank you so much. I shall rest my case now.
Thank you, Anshika.
May I interrupt for a second? I just wanted to say, like, since you're choosing the number and speaking at the spur, within a minute, collect your thoughts and then start. Okay. I mean, don't get panicky when you see you've prepared on both sides. So just collect your thoughts and then speak. You don't have to rattle off.
Okay.
And please take down the points of your opponents. There will be marks for refuting at the end of the debate.
Yeah, thank you, ma'am. Anshika Sinha had taken 3 minutes, 29 seconds. And next is Jeel Jain. Jeel Jain.
Yes,
yeah.
ma'am.
Yeah.
Ma'am, I would choose the number 10.
You will speak for the motion.
Ma'am, am I loud and clear, ma'am?
Yeah.
Yes. As the 3,000-year-old saying goes, Pehla sukh nirogi kaya, which means health is the first requisite of happiness. This still and will always remain true. I, Jeel Jain of DPS Udaipur, is speaking in motion of the topic. This is known to every person hearing me that COVID-19 can only be prevented by vaccination and no other so-called prerequisite. The fact that makes this statement solid is by looking at post-COVID syndromes like black fungus, diabetes, long-term problems, and much more severe symptoms. Who weren't vaccinated? I agree to my opposition that students have lost a lot due to closure of schools. But dear opposition, what sky is going to fall down for just waiting 3 to 4 months until all the student population also get vaccinated with the first jab? We have already waited for 2 years. Why do you want to play with the lives of fragile children? Everybody knows India in the month of October had administered 23 crore jabs. So at this accelerating speed, definitely students' population will be vaccinated in the few months. My opponents must be thinking that students are going to malls, playing, mingling with others, so open the schools, right? So that is the whole point. They're already mingling, even the schools have not been open. So just imagine when the schools would be open with 100 children around, and everybody knows how contagious COVID is. Several states have seen a rise in COVID-19 cases when the schools were reopened. Immediately when the schools were reopened in Punjab, infection rate grew to 9.6%. WHO has blamed the second wave of COVID-19 in India due to premature opening up of society, public measures, as well as emergence of new variants. I'm sure that everyone has lost someone they know in the second wave. I personally have lost my favorite teacher. Be aware, these situations still prevail and can easily cause the third wave with the more infectious Delta variant. When it is a trade-off between health and anything else, health prevails. My opposition is again and again emphasizing on the effects of lockdown on the mental health of students, that it is getting worse. And now they want to play with the physical health also. What courageous risk takers they are. My opponents must be knowing that some of the adventurous risk takers like them have opened few schools, and you will find the newspapers filled with new COVID cases. 613 students in the district of Solapur, Maharashtra have been tested positive in the month of August when the schools were reopened for 8th to 12th. In conclusion, I would like to say that it is not advisable for Safeline return to offline schooling now. Please don't let the boat sink when the shore is near. Until then, stay home, stay safe. Thank you.
Thank you, Jean. Thank you very much. 3 minutes. She's bang on time. So next is Himali Das.
Yes, ma'am. Ma'am, am I audible?
Yeah, you are.
Ma'am, I would like to go with number 13.
Himali Das will speak for the motion. You may start, Himali.
Good afternoon, everyone. I'm Himali Das from Don Bosco School, Silchar, and I shall be speaking for the motion. The first point I would like to start with is that after reopening of schools in Tamil Nadu, Kerala, Maharashtra, Haryana, and many more states, what the result was is that there was a spike of COVID-19 cases among children. About 400 children got affected in the outburst. If vaccination would have been there, no such similar situation would have occurred. So it was necessary to vaccinate the children before sending them to schools. Secondly, I would like to say that there is a saying, prevention is better than cure. Also, there is no other option except vaccination for sending the children to the schools safely. The third point I would like to mention is that there are millions and millions of children all around India. Opposition may oppose at this point. They might be saying that vaccination of millions of students is very time-taking. And I will not deny this fact. I would rather add up something in this point. Not long ago, when we were small children, we got our polio vaccination from our respective schools. So I would suggest the same thing in the present scenario. Our schools can take our vaccination responsibilities and ensure that every child of their school gets vaccinated. In this process, the school will also have a record of the students' vaccination, and it will definitely be time-saving. Next, I would like to mention that we all know Dr. K.K. Agarwal, an Indian physician, a senior cardiologist in AIIMS, and also the president of the Heart Care Foundation of India and many more, got affected to corona and passed away even after his second dose of vaccination. Now, that doesn't mean that our vaccine is ineffective, as said by a doctor, Dr. Arvind of Mitab Hospital Institute of Chest Surgery. This happened because probably he had a weak immune system, or his body could not create antibody to fight against the virus. Now, let us take an example of the learning students in school. Whenever the school tries to bring up something for the reopening of the schools, the parents has an objection, and they will definitely have it so. But if the children are vaccinated, the parents will be partially, be satisfied that the children are at least partially safe and will not hesitate to send them children to the school for offline schooling or offline exams. Therefore, I would like to end up by saying that vaccination is the only prerequisite for the children to the offline schooling under present times. Thank you so much.
Thank you, Himali. Time taken by Himali, 2 minutes, 48 seconds.
Okay, ma'am.
Arunima Biswas?
Yes, ma'am. Am I audible?
Yes, you are.
Ma'am, I would like to select the number 22.
So Arunima will speak against the motion. Arunima, are you okay? Start.
Yes,
you may
ma'am.
start.
Okay. A very good afternoon to everyone present here.
the honorable judges, and my fellow debaters. Today I, Anurima Biswas from Delhi Public School, Newtown, Kolkata, would like to share my views against the motion on the topic. Vaccination against COVID is the only prerequisite for Safeline return to offline schooling under present times. Over the past several months, schools and colleges across the country have had to make heart-wrenching decisions about whether and how to reopen. Yes, we can agree to the aspect that vaccination is a mandatory necessity to fight this virus. However, it is certainly not the only prerequisite necessary to win against COVID-19. The virus affects different people in different ways. In education settings, the faculty and staff tend to be at a much greater risk than the students. Due to age differences among the adults, COVID-19 risk is also correlated with race, ethnicity, gender, and income in ways that give everyone a pause. Opening schools and colleges probably increases one's life expectancy at the expense of others. Keeping in mind the fact that there are people in our country who still do not have vaccination and are perfectly healthy continuing their daily chores. If we exercise a tad bit more caution and follow the proper protocols such as wearing a mask that covers our face properly, stay 6 feet away from others while following the norms of social distancing, and wash our hands often with soap and water when we do not have a sanitizer, then all of us can succeed in sustaining and continuing with our lives in the pandemic. We have to understand that waiting for a vaccination to arrive is pointless as it is a matter shrouded in uncertainty. As responsible future leaders of this nation, it is our responsibility to avoid as much physical interaction as possible while following the proper social norms to fight against COVID while maintaining a strong will and not giving up. Maintaining simple precautions like covering your mouth and nose with a bent elbow or tissue when you cough or sneeze and disposing of used tissues immediately and cleaning hands regularly is a must. Vaccination does not ensure full-fledged immunity, thus other health prerequisites must be maintained all the time. It has also been declared that a hybrid learning is being introduced in most of the schools across country, which means that physical schooling will not be on a regular basis and students will get the liberty to attend both online as well as offline classes simultaneously. Furthermore, continuing prevention measures like lockdown, distancing, and masks will be necessary until herd immunity is reached. With rich nations buying up billions of doses before vaccines are even approved, there is a lot of concern that the lack of adequate financial resources could delay the procurement of vaccines. Thus, I would like to conclude by saying using child vaccination as an excuse to avoid physical schooling is nothing but a futile and vain vindication in the end. Thank you.
Thank you, Arunima. Shipra ma'am, are you? Three minutes, 5 seconds. Okay, thank you, Shipra. Ankit Cherian.
Good morning, ma'am. Good afternoon.
Good afternoon.
I choose number 16.
16. Okay.
Yes.
Okay.
Yes.
Ankit will speak for the motion.
Today's good morning, again good afternoon, and I'm Ankit Cherian from Sharda Mandir School, Goa, and I'm going to speak for the motion. So the topic for today is vaccination is the only prerequisite for Safeline starting of schools. So the word says the only prerequisite for starting schools is vaccination. This means that to start the schools, the vaccination is necessary, and I truly stand for this topic. This is because over the past 2 years, we have seen that with this school. Sorry, I'm not able to get my words.
You relax and take your time and say it's okay.
Yeah. Over the past 2 years, we have seen that with the schools being shut down, and the people have become more and more health conscious, and they have started to realize that above there is nothing we can have above our own health. And I'm sorry.
Ankit, would you like some time? I think you've got that. Okay, let's give him some time. So everybody, can we go on to the next speaker, please? Relax. We'll come back to you later. So everybody, please go on to the next.
Sure. Thank you, ma'am. Manyata Chaturvedi. Manyata Chaturvedi. Yeah.
Again, I say, please relax and speak. I mean, you're not appearing for an exam. You're not being passed or failed. It's no judgment on you. Relax.
I'll be choosing number 18.
18. Okay.
Yes, ma'am. Okay.
Okay, are you ready now?
Yes, ma'am.
Okay, Manyata will speak for the motion. Yeah, Manyata.
I'll be starting in 3, 2, 1. Change is the only constant. And with the willingness to move along with the dynamics comes the acceptance to explore what lies ahead and the power to endure it. Coronavirus or COVID-19 in India started with just a 14-hour curfew on 22nd of March. We never thought in our wildest dreams that this curfew would turn into such a disastrous and almost apocalyptic event. I think I represent the students when I say that the early stages of the lockdown were really fun and amazing. With time, we started adapting to the conditions. We adapted to the online platform. Teachers and students tried their best to connect with each other via different platforms. However, it was the end of August or September when we realized that we were missing out on so much. We started missing our classes, our schools, and taking part in different activities and so on. I do support the statement that we should go back to school even though we're not vaccinated. The points that I would like to keep forward to support my statement are: number 1, through the offline study, the teacher will be able to understand if each and every student is getting a point correctly or not. During the offline study in schools and colleges, the entire class time is dedicated for teaching and learning. Offline classes are also available to those who do not have proper internet connections or those who do not have smartphones. The face-to-face teaching can help the teachers to understand the body language of students. And according to a survey done by the Times of India, about 28% of students cannot attend online classes because they do not have smartphones. The COVID-19 has meant schools across the globe have closed over 1.2 billion children no longer in the classroom. I think we should reopen schools as long as the school authorities can manage the COVID protocols while balancing, I repeat, while balancing the learning and growth of the students. Thank you.
Thank you, Manyata.
Manyata takes 2 minutes 15 seconds.
Judges, please note 2 minutes 15 seconds. Just a minute. Sorry. Yeah. Himanshu Gupta. Himanshu
Yes,
Gupta.
ma'am.
Yeah.
Yes, ma'am. Number 24. 24.
Himanshu will speak for the motion.
Yes, ma'am.
You can speak now?
Yes, ma'am.
Okay.
Good afternoon, honorable adjudicators, respected Mr. Ma'am, the members of the opposing team, and the audience. I, Himanshu Gupta, a proud student of Ivy World School, would be debating for the motion. Vaccination is the only prerequisite for safely return to offline schools under present times. From the year 2020, we have been stuck in this little pandemic of COVID-19. Day by day, the mortality rate of a country has been increasing. Certainly, it is not at all a wise and secure decision to open educational institutions till the time all of our young youth is completely vaccinated. Opening of educational institution poses a great risk to students, teachers, and staff members. Students have social interactions, therefore putting many at risk. Students traveling in public transport may share conveniences, thus potentially affecting others. In case if there is an COVID outbreak in a school, then the frantic rush of parents and children to hospitals and testing centers would be unmanageable. The pediatric wards and hospitals would be overcrowded, putting immense pressure on doctors and healthcare workers. We would need additional quarantine and isolation facilities because most of the houses are bijou. Moreover, it would be difficult to abide by the concept of social distancing as it is difficult to follow in poorly ventilated and overcrowded schools. It is reportedly said that most of the schools in India are poorly ventilated and overcrowded. There are a number of children with comorbid situations. In this condition, it would be very difficult to enforce preventive measures on them and shield them. In my opinion, government should instead continue with the online mode of teaching. It is true that there are some defects in its delivery of mechanism, but then existing infrastructure like television and telephone can be used meticulously and be leveraged. We know our parents value our lives more than theirs, and seeing us suffer would be emotional turmoil for them. At the end, it is right to say that nothing is more important than life. Children could only study if they are physically and mentally sound. I will rest my case. Thank you and have a nice day.
Thank you, Himanshu.
Himanshu takes 2 minutes, 35 seconds.
Okay. Thank you, Shipra. Jia Ved is the next contestant. Jia
Yes,
Ved. Yeah.
Ma'am, I would go with number 21.
21. Okay.
Yes, ma'am.
So you have to speak against the motion. It's okay?
Ma'am, am I clear?
Yeah.
Good afternoon to one and all. The topic for today's debate is vaccination against COVID is the only prerequisite for Safeline return to offline schooling under present times. And I, Jia Bed, a student of class 10 of Don Bosco School, Silchar, would like to speak against the motion. COVID has been hard for everyone, but especially hardest on school-going children. If we wait for them to be vaccinated, we'll be wasting more of their formative years. The WHO said that the kids don't need to be vaccinated to attend schools. Dr. Catherine O'Brien, a member of COVID expert committee, said that, and I quote, "There's no requirement for teenagers or kids to have to be vaccinated to attend schools. It's about the protection of adults around them, who are the ones who really have more risk of the disease." Unquote. So adults at home need to be fully vaccinated, which is anyways a priority. My second point is that India started its COVID vaccination from 16th January 2021. It has been more than 9 months, and in spite of the massive efforts, not even 40% of the total population is fully vaccinated. So we can safely assume that if we wait for all the children to be fully vaccinated, it will take another year or more. So can we afford to keep them home for another year? No school means no exercise and hours spent in front of screens. Isn't it worse than COVID? What we can do is open schools now when the cases are low. If they rise again, exponentially, a call can be taken to shut schools again. Risk is anyways very low for 6 to 17-year-olds. In Sweden, 1.9 million kids attended schools without masks between March 2020 and June 2020. 15 developed severe COVID and none died. In fact, it is only as bad as influenza for them.
My third point is that the ICMR, Indian Council for Medical Research, did a seropositivity survey and found that 50% of the children between the ages of 6 and 9 had antibodies, and 61.6% of children between the ages of 10 and 17 years old had antibodies. So they have fought off the infection successfully without even knowing it. So higher percentage of children have antibodies than adults with double vaccination. So if adults can gather for election rallies, weddings, and Kumbh Mela, why can't children go to school? Is it not their fundamental right? Sometimes we have to make tough choices, but the choices we make have to be made by a careful consideration of what is of greater good for the maximum people. And it is the interest of the children and parents alike that we do not waste another precious year or two in waiting for the children to be vaccinated. They deserve to be back where they belong. Here I would like to rest my case, but not my stance. Thank you.
Thank you, Jia.
Jia takes 3 minutes, 13 seconds.
3 minutes, 13 seconds?
Yeah.
Okay. Okay. Now next is Mansi Singh.
Yes, ma'am. Ma'am, I'll take number 17.
Have to speak for the motion, Mansi?
Yes, ma'am. Ma'am, should I begin?
Yeah.
Hello, I'm Ansh Joshi, and I'll be speaking for the motion. Vaccination against COVID is the only prerequisite for the Safeline return to online schooling under present time, offline schooling under present times. Firstly, vaccination can be defined as the administration of a vaccine, which is preparation that is used to help the immune system develop protection from a disease. Once your immune system knows how to fight a disease, it can often protect you for many years. Many infectious diseases are rare or eradicated now as a result of immunization programs. They have been one of the greatest public health achievements of our time. The more people who get vaccinated, the fewer people will get infected, and the less widely a disease will spread. Only vaccines can protect the students in a school in a case of a mass outbreak. In 1950s Australia, thousands of children died every year from diseases such as pertussis, diphtheria, and others. But due to the major vaccination programs introduced in the 1960s and 1970s, it is rare for people to get them now. Smallpox, which killed up to 300 million people and existed for about 3,000 years and was one of the world's most feared diseases until it was eradicated by a collaborative world global vaccination program led by World Health Organization. People who have pre-existing or neurological conditions which prevent them from getting vaccines and children who are too young to get vaccines are at a high risk during this time. But they can be protected if the people around them have the vaccinations up to date. In some people, long-lasting health effects and chronic effects such as long-term breathing problems, heart complications, stroke, and Guillain-Barré syndrome, a condition that causes temporary paralysis, may occur. Data from multiple COVID-19 vaccine research, however, states that the vaccines protect people from the most severe of the outcomes of the diseases and hospitalization and death. Life expectancy of the people who have contracted COVID in many of the countries is expected to drop in the future by 2 to 7 years in Southeastern Asia and by 3 to 9 years in North America and Europe. There has even been an analysis study that reveals that with an increase in vaccination rate, there is a reduction in the frequency of viral mutations. Thus, vaccination can reduce the chances of their developing a strain that affects children much more dangerously than adults. Mutations among people have been taking place mostly in places where people have had not yet been vaccinated. Since they are at a higher risk between unvaccinated people, acquiring herd immunity through vaccines is necessary. Russia's catastrophic fourth wave is a cautionary tale for a failing vaccination campaign, showing their difficulties in correcting posts after the government's confused and on-off messaging about COVID-19. To conclude my speech, I would like to say that vaccination against COVID is the only prerequisite that can provide us with a safe line return to offline schooling during these present times, and is also the fastest way in which we can bring things back to normal in the future. Thank you.
Thank you so much, Mansi.
Mansi takes 2 minutes, 46 seconds.
Okay. Next. Thank you, Shipra. Next comes Sheetal.
Yes, ma'am.
Okay.
Ma'am, 23.
He will speak against the motion. Yeah, Sheetal.
Can I start, ma'am?
Yes, please.
Good morning, respected teachers and dear friends. I am Sheetal, studying in 10th class from A1 Public School. We are here for a debate on the vaccination is the only solution for Safeline return to offline schooling under present times. I think vaccine is not the only prerequisite for Safeline return to offline schooling under present times. According to me, precautions can be taken both inside and outside the classrooms to prevent the COVID-19. Make sure to use information about COVID-19 from reliable sources such as UNICEF and WHO, as well as the health authorities in your country. By staying informed about the situation and following the recommendations of public health experts, we can protect our own well-being and those around us. We can also save by taking some precautions like actions to take if a student appears sick, cleaning and disinfecting tips for the classroom, social distancing. We can maintain a distance of 1 meter or 3 feet between everyone present at school. Increase desk spacing, stagger recesses, breaks, and lunch breaks. Use a hand sanitizer that contains at least 60% alcohol. Students must wear masks in school. Everyone over age years should wear masks that cover the nose and mouth. This is a simple prevent tool to protect students unable to get the vaccine yet or who have not chosen yet. Go and get it. When possible, school should use outdoor spaces and unused spaces, instructions, and meals to help with distancing. Activities like singing, band, and exercising, for example, are the safest outdoor and spread out. Thank you.
Sheetal takes 1 minute 56 seconds.
Sheetal, thank you so much. Our next contestant is Arya.
Yes, ma'am.
Yeah.
I would like to go with number 11.
Arya will speak against the motion. Okay?
Yes, ma'am.
Okay, start.
Good afternoon. Myself, Arya Swapnil Rathi from Delhi Public School, Nashik, studying in grade 9. And today I would be speaking against the motion. Friends, it is rightly said that precaution is better than cure. Accordingly, vaccines have been promoted as the most formidable weapons by the governments and WHO in the war against COVID-19. But friends, I would like to add that vaccines, though the most formidable weapon, is not the only mean as a precaution against COVID-19. Along with vaccinations, following COVID-appropriate behavior such as wearing masks, maintaining social distancing, washing hands regularly is equally important. We all know that an ideal vaccine development is a long and complex process, often lasting 10 to 15 years. But this COVID vaccine has been developed within a record period of time, around 10 to 12 months. Though it is effective, there are many question marks. We don't know how much time the immunity from the vaccines against the virus will last. This is seen from the fact that many countries with a record number of vaccinations, such as the US, Israel, have started booster doses for the population with weak immunity. What we need today is a vaccine that would stop the spread of infection from the vaccinated people. But the vaccines available today are providing us immunity against severe disease, but they still don't stop the spread of the virus from the vaccinated people. We can see nowadays that many people, even after taking the COVID vaccine, get diagnosed as COVID positive. So vaccination is not the last straw. Also, we come across the concept of booster dose, which has been introduced. So this means that the antibodies created by the vaccine don't stay in the body for long. We have to take another dose as a booster dose. Vaccination is not the only resort to start the schools. Taking proper precautions and following COVID appropriate behavior is a must.
So by stating all the above points, I would like to say that vaccination against COVID-19 is not the only prerequisite for Safeline return to schooling, for offline schooling under present times. Thank you.
Thank you, Arya.
Arya takes 2 minutes 18 seconds.
Okay. Thank you, Shipra. Next is Ansh Joshi.
Yeah, good afternoon, ma'am.
Yeah. Yes.
Ma'am, I would take 15.
15, okay.
Against the motion.
Yeah.
Yes, ma'am. Good afternoon, myself Ansh Joshi of class 10th from Tagore International School, and today I am here stating against the motion. Vaccine for the kids have been a topic of debate for a long period of time when it was decided that a vaccine would become for the children also. And Covaxin of Bharat Biotech being approved by ICMR and the expert panel for the emergency uses during the second wave only. Covaxin is unactivated viral component. Hence, we should all keep in our mind that the data which is released by ICMR is not completely. We have to go for the complete data also, because complete data is not available on the net. As well as, however, it is recommended that the parents should also wait for some period of time till the whole data is released by ICMR. As well as, if you are particularly talking about vaccine, there are many exceptions and the questions as well as the queries in the mind of the parents regarding giving the vaccines to the children's. What quantity of dose should be given to the children's, then what are the inflammation which would occur after giving the vaccination. As we all know that as the children are the vulnerable group of our society and super spreader also. After getting the vaccination also, apart from the vaccination, we have to practice the other protocols also which are given by the ICMR. As well as, if we take the example of America only, after getting the vaccination, the children under the age of 18, there thousands of cases came in which the myocarditis, which mean the inflammation in the heart muscles occur, due to which the children suffer from it. And 40% of children in America does not develop the antibodies after the vaccination. As well as, if it come in India also, so the government of India is ready to take all the risk and burden after this. Then if we talk about that, there are many other questions also there, such as like occur during the adolescence, because between the age of 12 to 18 it is known as the age of adolescence, and there are many changes which occur in the body. So if the vaccine is applied to the student, there can be any change in the body. Then there are many children who suffer from the transplantation. There are many students where there are many children who suffers from the implantation operation. So the vaccine could be same for them also, or could be different for them. As well as, after getting the vaccination, we have seen many inflammation which occur in the human body. For example, in the adults only, we have seen the vomiting, redness at the site of injection, or the body pain, back pain. So it could be same, and it could be danger for the children's also. As well as, we have to keep in our mind that the vaccine would only prevent the child for not getting hospitalized or for the death, but it would not it would not stop the transmission of that disease. The child will also transmit the disease in the same way. As well as, in India only 1,000 volunteers were there, out of which 16.1% of volunteers does not develop the antibodies after the co-vaccine. As we know that children are one of the most valuable part of our human society, and parents used to protect them and want a safe confines for them. So, but due to the lack of the data which is given by the ICMR and lack of the exception, so we have to follow all the protocols which are given by the ICMR also. As well as, we should wait for some time, and then after take some decision for the offline study for sending the students without the vaccination. And in last, I only want to conclude by saying one line of Alexander Dumas, that hope is the best doctor for everything. So we should hope and should wait for the time. Thank you.
Thank you very much, Ansh.
Ansh takes 3 minutes 46 seconds.
3 minutes 46 seconds. Maitreyi Khanna is the next one. Maitreyi.
Good afternoon to everyone.
Good afternoon, Maitreyi.
To all my people.
You can see the most of the numbers are gone. Unfortunately, third row is absolutely gone. So
Yes, ma'am. Ma'am, I would like to go with number 6.
yeah, okay. Let's see.
Which for the motion.
Oh, you're happy. You seem happy. Okay, fine. Good.
Ma'am, can I take few minutes before starting?
Sure.
Thank you.
Maitreyi,
yes,
I think collect your thoughts and start. It wouldn't be fair to others.
Okay,
Yeah.
ma'am, okay.
Relax and
Thank
start.
you. Yes, ma'am, of course.
I think you should start now, Maitreyi.
Yeah.
Okay. If health is the major priority, then why? Why we are risking it? Safety of children is the topmost priority of our parents. We have to understand that coronavirus is not going anywhere right now. And for this, vaccine is very essential because vaccine helps us to boost our immunity and helps to generate antibodies inside us, which will let us not fall ill. We are still not sure about the end of the coronavirus yet, due to which the possibility of lockdown may increase or it may be a lockdown. We should understand that waiting for a few days is better than a longer period of lockdown. Because lockdown will harm the education of children for a longer period of time once again. And there will be none of us who is here among us who does not know about the disadvantages about the closure of the school. If we talk about the scenario from before to present, then the present scenarios are much different and much better than the previous ones. Now, the online classes are going better day by day, are going better and better and better. The underprivileged children are also getting the opportunity to get access to online classes. Now, the ways are coming out to help the underprivileged children and many children who are in need of such devices and electronic connectivity. Everybody is talking about that children are at very least risk, but still the risk is there. And what if the children get infected? The death is not the only major concern. Last time in the second wave, a boy of 17 years got infected from coronavirus and he also got attacked by black fungus, which is a very big harm to our health. The death is not the only major concern that we should emphasize on. There are many other such things also that we should focus on, like a healthy living. If by mistake or anyhow we get coronavirus, then the healthy living will be really difficult or it will be really hard. Second thing, many of my opponents are talking about mental health. Then let me tell them that mental health can be, yes, the mental health can be maintained at home only through meditation and yoga and various physical activities and staying with our family members. And there is no harm to mental health at all.
But if we go to school, there will be a physical health also. And the recent studies show that people who are affected by coronavirus have got into depression even after when they have recovered. Then the mental health is much better now than if she got infected. We should understand that if the coronavirus will increase, then there are many chances of exam cancellation and postpone of careers, which many of us will want it. That is why it is better that all of us put vaccine and make it use first, because haste is always a loss. Thank you.
Thank you, Maitre. Thank you, Maitre.
Maitre takes 4 minutes 11 seconds. 4 minutes 11 seconds. Yeah.
Okay.
Yeah.
Now next is Shinjay Datta.
Yes, ma'am. Am I audible? Ma'am.
Yes. Little bit of. Can you say again? It's a little bit of echo I could found.
Ma'am, am I audible now?
Yeah,
Yes,
you are.
beta.
Ma'am, I choose number 7. I am Srinjoy Datta of Delhi Public School, Newtown, Kolkata, and hereby I will be speaking against the topic. As we know, 41% of the population of India accounts for less than 18 years of age. Vaccination of this huge number will be a time-consuming and lengthy process. The latest update by Times of India states that COVID vaccination for kids may start from March 2022. Covaxin aims to develop the double-dose vaccine for children between 12 to 18 years of age, although its functionality is questionable. Moreover, individuals who are Covaxin certified are not accepted in most places abroad. So students who aspire to study abroad might have to face some difficulties. Vaccination reduces chances of death by a great extent, but it cannot resist the virus from affecting us. So for Safeline return to schools, vaccination cannot be and should not be the only prerequisite. Social distancing, sanitizing, mask wearing, and all other COVID norms, if followed, could lead to a probability to safely return to offline schooling. The COVID pandemic is starting to transform into an endemic. So if we give the cases a little time to suspend, rather than rushing with vaccination and immediate change to offline schooling, it will lead to better results. The adults, in order to take vaccine had to wait for long hours in queues, but the children would not be able to do the same. Vaccination just reduces the intensity of the COVID infection, but the weakness lasts. I am myself a recent COVID affected individual and non-vaccinated. By my experience, I understood that we teenagers are away from any severe dangers as we have a highly developed and active immune system. So vaccination is not an immediate need, except the individuals inflicted by any disease. Even without vaccination, we can return to offline schooling if extremely strict COVID norms are followed, and the staffs and teachers are well versed with the new systems. Students should imagine wearing masks, sanitizing, and maintaining social distancing as a part of their daily life and accept it as the new normal. Looking at all these points, I hereby conclude and state that if we have to return to school at present times, vaccination is not only the solution. Thank you.
Thank you, Shinjoy.
It takes 2 minutes 40 seconds.
2 minutes 40 seconds.
Yes.
Sakshi is our next participant. Sakshi Vaswani.
Am I audible?
Yes, you are.
I will like to take number 12. All right.
Sakshi will speak against the motion.
Yes, ma'am. Okay, so, and like the moon, we must go through phases of emptiness to feel full again. No doubt that these 2 years were both fortunate and unfortunate. Fortunate for some, unfortunate for many. Hello everyone, this is Sakshi Vaswani of class 12, Tagore International School, Jaipur. Humans are caged inside these four walls. All the joy, happiness, creativity, all are packed and couldn't come out. How much it all will remain like that? Can't we all win over this virus? Or maybe we already have, but the fear of this virus is now in the air. Everything is open, shops, malls, parks, restaurants. Then why can't schools? Students are future of the country, they say, right? How can we create a future if students aren't stable in the present? Now, how can we create the future if the name on the health is only prioritized physical health but not mental health? According to studies, 74% of Indian students suffer from high stress. The COVID-19 pandemic and lockdown has impacted students across the world by keeping them away from their peers, cutting down physical activity, and making them miss key aspects for their growing up. Paying attention to mental health, the study says that over 53% of Indian university students suffer from moderate to extreme self-depression. 58% of Indian college students experienced a significant increase in their stress levels and self-deterioration. In their emotions of anger, anxiety, loneliness, emptiness, hopelessness, and happiness. How much we have to wait when we already have waited 2 long years and life is running back to the COVID pandemic era. As I said earlier in the second round, I stated this helpline number had received 50% more calls for child abuse, mental health, and child marriage. Do you think that in these cases, schools shouldn't reopen? I totally agree that health should be our first priority. But how can we forget that mental health too counts in that? And no, mental health can't be just, cured by sitting at home, by doing yoga or whatever meditation it is. What about those children who are facing abuses in their home? What about those who don't have any access of Wi-Fi or this smartphones and all, who don't have much technology to access all these online platforms? The cases are too low now. It's, I guess, 0.52 or 0.54%. That's it. And the virtual world is disastrous. We shouldn't forget that. All these students are waiting eagerly for all those morning assemblies, all the good morning ma'am songs, and all those activities. They are eagerly waiting for physical interaction with their teachers and friends. So, in my opinion, school should reopen. We should all be brave. The cases are too low, and now it's the high time we should go for offline studies, because online studies aren't beneficial, and we all know that. As I am a student, and I can say that definitely. All the birds find shelter during a rain, but eagle avoids rains by flying above the clouds. This statement is by APJ Abdul Kalam. So let's be brave. We can and we will. Thank you.
Thank you, Sakshi.
Sakshi takes 3 minutes, 39 seconds.
3 minutes, 39 seconds. Now we come to the last participant, Yasna Anju. Yasna, thank you for patiently waiting for your turn. Yasna?
Ma'am, I would like to choose 19.
19, okay. You will speak against the motion?
Yes, ma'am. Can I start? Am I audible?
Yes.
No, it can never be the only prerequisite. I, Yasna Anjum Majumdar of 10th Standard Don Bosco Silchar, will be putting forward reasons and evidences against the motion vaccination against COVID is the only prerequisite for Safeline return to offline schooling under present times. As our previous speakers have put forward the theories in favor of vaccination, I will be offering science-based answers and impressions to refute them. The query is it a good idea to reopen schools now as there is a risk of third wave? The answer is a big yes, because the risk to children between 6 to 17 years of age is very low. What about very young kids who have never attended school? Well,
They should also go to school with the exception of children with a pre-existing health condition. As per available global data on the age distribution J-shaped curve, primary schools must be the first to resume classes. And if there is a rise in cases, a decision can always be taken to shut them down. The World Health Organization has categorically stated that children need not be vaccinated to go back to school. But the parents are not accepting this. Schools and administration should educate parents to allay their anxiety and fear. Leaving behind all the paranoia, the focus should rather be on vaccination of teachers, school staff, improving ventilation, wearing masks, and following COVID-appropriate behaviors inside the classroom. Children from poor families are the worst impacted as schooling is their only way to education and nutrition through midday meals. Let's get back to the whole idea of vaccination. Foremost, we need to de-link vaccination with opening of schools. Though COVID-19 vaccine has been licensed for 12 to 17 years, but due to unavailability, the vaccination is not being done yet. In fact, no country is vaccinating children younger than 12 years. Even if we start today, it may take a long time to vaccinate all the children in India. Countries who have abundant vaccine also are refraining from vaccinating all the children. In my view, panic is the only major problem now. Otherwise, science, studies, and epidemiological data are very clear. And they say, open the schools, please open the schools. Thank you.
Thank you, Yasna.
Yasna takes 2 minutes, 44 seconds.
Ma'am, Ankit Chelian, I think.
Yes, ma'am.
Are you ready now?
Yes, ma'am.
So, judges, can we give him a chance?
1 minute. Do we have any extra?
Yes, please.
Judges, do you
Yeah, I
agree
think
we
let's give him a chance. Let's give him a chance.
Please, because we have to encourage and motivate them. So relax.
Of course, definitely, definitely.
Thank you, and I'd like to start by apologizing for earlier. I'm very sorry. Yeah, so my topic, I've been told to speak for the topic. So I'd like to start by speaking about Russia. Of late, we have seen a huge increase in the number of cases as well as the number of deaths, which also goes along with the fact that the vaccine coverage in Russia is extremely low. This points to the fact that vaccines are necessary for keeping down the rates of death and new cases. Secondly, once we start schools, if we start it now, all my opposition has already said that we'll have to ensure that social distancing, students are wearing masks, sanitization is done frequently. But I went to school last month for my exams, and I can assure you that the students will not in any way help the teachers in keeping social distancing, because as much as the teachers say, there is always students who come together, they mingle. You can't put 40 to 50 students in a small area and expect them to stay 6 feet away from each other at all times. Even wearing masks. In the classroom, the teachers can easily make them wear masks, but as soon as they step out of the compound, they are still interacting with each other, still talking with each other, but they might remove their masks and we cannot control them about that. Thirdly, we have online school. It might not be perfect, it might be difficult to concentrate, but it is safe. We are able to keep our health, keep our safety in our homes and attend our classes at the same time. And that is a great thing. And and when we have such a facility, I do not think that we should be risking our lives and going to school. Thirdly, in India, we have already 100 crore vaccines have already been given out, and all these people have already been given at least one dose of a vaccine, and the pace is picking up. We are slow, and I believe that within a few months, all the children between the age of 12 and 18 will also be vaccinated. And so I say that it will be good that we wait for another few months wait for us to get vaccinated and then start schools, because it is exponentially safer. And with that, I would like to rest my case. Thank you.
Thank you, Ankit.
Ankit takes 2 minutes 29 seconds.
Thank you, everyone. All the students, you all were very good, and you all were loaded with lot of information and data. So I think, Arundhati ma'am, should we start with our next round of refutal?
Yeah.
So
I'll just just let me connect with them. Excellent. Whatever you did, however you did, the fact that you had to speak extempore at the spur of the moment, I think it was very good. You know, we put a twist to this debate because you all were so good earlier. We thought that if you had to say the same thing on today, you would all be first, and that the judges would find it very difficult. So we put a twist over here that you had to pick and choose at the last minute. And I think I may not have done as well as you did today, because you had to prepare both sides, organize your thoughts and speak. Excellent. Whatever you've done, you've been very, very good. Now, the next 10 minutes, you're going to refute each other. I think we told you had to collect points against one another. And for the refuting for the next 10 minutes will be marked. In the sense, there's not going to be any negative marking, but if you come up with good points and you're able to refute your opponent, the judges would request you to put a +1 if you think their points are good and they've been attentive and they've done well. You all are experienced on this, so I won't go further on that. After those 10 minutes, the refutal will continue, but not on marking level, and Dr. Chaudhary will be interacting with you on this while the judges tabulate your marks and we get together with the evaluation of your program today. I just wanted to say that regarding the prizes, since we are all going through a crunch, whatever crunch we may call it, social, economic, financial crunch, but we are giving a national prize kitty to the first one who comes first all across the states, a cash money of 3,000. The one who comes second, it would be 2,000. And the one who comes third would be 1,500. And to the winners of all the states, like the first winners of all the states, it will be a cash prize, a token cash prize of 1,000. Now, I would like to clarify, like suppose from the state of Punjab, say a person has come first. So he or she gets a cash prize of 3,000, but then because we want to increase our outreach, we will not be giving him the regional first. Okay, so the next person who has got the highest in Punjab will get the regional first. Okay, is that clear, ma'am? Yeah, Ashwita, Ivy, and Sonali, this is
I think
that's very fair.
Very fair.
Because we want to increase the number of prizes, and we want to encourage everyone. So what we see as 22 students today, we want it to be 42 within 6 months. That's the idea. We want to reach out to you. So Dr. Chaudhary, where are you?
I'm here.
Yeah, you're here. So we start with the rebuttal round for the next 10 minutes. In the meantime, judges, you can start tabulating and then add +1 wherever you think it's necessary.
Ma'am, I had a doubt. Can we name the student, or we just have to speak on a base level?
You don't have to name. You can, if you remember the name, fine. But if you don't remember the name, it's not that it's going to be a negative marking. Okay.
I would suggest that don't name the student. The reason is that there are no teams in this. These are all individuals. Yes. And the issue is that, we would like you to play with the idea and the thought rather than the person. So that's what we would like to encourage you for. Okay.
I think just pick on the points. That's the point.
Ma'am, I have a question, please. We are marking the question, therefore that means if the question is good, we give a +1. The rebuttal question and not the answer, if they are directing it.
No, Ashrita, it's like this. Like if a person asks a very good question, which you think is, worth taking a point, +1, and the person who refutes it, if he does it very well, then +1 there also. Because see, one has to have the presence of mind to ask and the presence of mind to reply.
answer. All right.
To answer.
Ma'am, may I ask my
And,
question?
each child gets only one chance to rebut. Each child gets only one question to ask, and no rebound rebuttals.
I just
have one
rebound.
Fair, ma'am.
For the judges, if I may add, focus more on whether the conversation of rebuttal, the question or the answer, has elevated the thought process and discussion on the topic, rather than the speech and so on and so forth. So, I mean, if you go back wiser, that means there has been a good contribution, and we should recognize that. So that would be.
I just have one suggestion, that when you're asking a question or whatever you're responding, you please tell your name, because it's online. So, sometimes we are not able to see who's speaking.
Absolutely.
Okay, ma'am, may I ask my question?
Dr. Chaudhary just said. Could you just repeat that, Dr. Chaudhary?
My point was that, we want to encourage the thought process rather than, the speaking performance. Speaking performance is one thing, but what we did today, there are many people here who spoke very extempore, and they conveyed very beautiful thoughts in 2 to 2.5 minutes. And, one could actually understand that their mental process was very sharp, and they had understood some of the subjects very well, contemporary health issues. That's what we would like to encourage. So I would leave that to the judges, that look at the overall performance in terms of how it has elevated the thought process of the debate, rather than only the performance of speech. Is that okay?
Can I start?
Ma'am, may I ask my question?
No, before that, can all your raised hands come down for a while? Because before that, I have to ask for a show of hands. So I'll give you a chance. Don't worry. Okay. So all of you, if you put your hands down for a while, just remove them. I just want to ask one fair question. How many of you actually did not at heart feel that the topic that was given to you is what you felt from within, and you had to adjust only because, this was the task given to you? You understand? There's a for and a against, So how many of you felt that actually from within, your heart was not in what you had to speak? Anybody? I mean, it's not possible that all of you, okay, so I can see one plus hand. Jheel Jain, right? Anybody else? No. Okay.
Yes, sir, it's me.
Okay.
We have Manyata also raising a hand, I guess.
So now people are opening up. Fair enough. So I just want to tell you that, a debate is a platform where you have to take a stand. It's almost like, what lawyers do in a court. I mean, even if you know that the person has been a criminal, but you have to defend, just because that's the job that you are set out to doing at that point in time. But your heart may not be with the topic, in the sense that your personal views may be somewhat contrary. Fair enough. I just wanted to get a view of how many of you were put to a lot of disadvantage. So about, I think, 4 or 5 of you. Yeah, not too many. So others were equal both ways, whichever way it came, which basically means that the topic given to you was a fair topic. I mean, there were enough points on both sides of the coin.
Yes,
Otherwise,
sir.
you would have felt very disadvantaged.
Yes,
So we are quite happy with the topic that we chose. Now we go to the rebuttal part. So I can see a few hands, and we'll start one by one.
So may I start?
Yeah, the electronic hand. Okay, fair enough. So I think we have Roman that's the first. Okay, go ahead.
Okay. Thank you for the recognition. So I have a question for Jiabad. Ma'am, you mentioned and quoted in your speech that children do not need to be vaccinated. But I have a question for you. How can you say that? How can you justify that? Do children's life don't matter? Because people who are below the age of 18 haven't developed completely in physical, haven't developed physically, mentally, or financially. So how can these vulnerable and precious lives be left unprotected just for the sake of schooling schooling just for the sake of education in an offline manner. How do you justify your stance?
That statement was not said by me. That was said by the World Health Organization and also by Dr. Catherine O'Brien, as I mentioned in my speech. And she's a member of she is the member of the COVID expert committee. She said that.
Ma'am, I mentioned in my speech that, ma'am, I mentioned my question that you mentioned and quoted that. I did not say that you said it yourself, but you quoted it. So you must have some sort of substantial backing up while quoting it, right? So I just want to know what's your thought process behind quoting that.
I think rebuttal will just be one question and we'll leave it at that. Not a cross questioning.
Okay, let's go to the next person. I can't see her video though. I wish I could. Okay, Mansi, your question?
My question is for Simone Sharma. I will quote you. You said that 1 million children who get vaccinated will get headaches for that one child who could die. So, but should they wait until they are the one that has to die, or should they take the vaccine as a preventive measure?
See, what I meant by that is when one person, they get headaches, let's say that, and what I say is that one person can die. Just because of that, 1 million people have to take a vaccine and put their life at risk because of that. Because I have already mentioned a number of disorders that I have mentioned in my speech. So would you rather be suffering, let one person die, or would you rather millions of people suffer because of that one person?
I think fair enough. Let's go to the next question. Arya, your turn now.
Yes, sir. Sir, so people get COVID positive even after taking the vaccinations. So those who were for the motion, I wanted to ask, how is it the only and final solution for reopening?
So at how close to the topic?
May I please? Mama, so I didn't understand the question. Can she repeat it again?
Yeah, can you repeat it?
Yes, sure. I wanted to ask that people get COVID positive even after taking vaccinations. So those who are for the motion, anyone can answer. For the motion, I wanted to ask, how is it the only and final solution?
So the point she is making is that it's not an ideal solution. It's not 100% safe and 100% effective. So what are your views on that? Is that the question? Can I frame it on your behalf? Yeah.
Yes, sir.
Yeah.
May I answer?
May I answer this question?
May I answer?
Yeah. Yeah, go ahead. Who's answering?
So may I, Manyata?
Yeah, go ahead.
So when we talk about vaccines, considering vaccines, social distancing, and all the drugs, we must never forget that these are all precautions and, not surety of someone's life being out of the red circle. So, of course, we shouldn't just focus on the vaccines, and the schools should definitely focus on different more, precautions, so that the students are able to come back to school and not get affected by vaccines. And also it should not affect the growth and the learning process of the child.
I would like to add here that COVID is a virus, and virus can only be prevented by a vaccine. Yes, I do agree that there would be some cases that COVID did not after the vaccination, people get COVID. But the main point here is that after the mortality rate decreases to less than 0.06%. That is the point I want to make. That it is scientifically proven that vaccination is the only cure for COVID. Then how can you say that after being vaccinated you are also getting COVID, but you are not in that much risk? Are you willing to take that much risk?
May I also please answer to the question which came from the opposition side? Actually, I was for the motion.
Go ahead, Himali.
Yeah, I would like to add to her question that we all know that people, even after the second dose of vaccination, got affected to corona, and I do agree. So I would like to add up that the infection rate in them is
compared to nil. Like the infection rate is not as much as the as found in the people who are without vaccination. And I also would like to them that life risk in them gets reduced. They are more prone to live than to die if they are vaccinated. So, and the person who died, the person who died even after second vaccination, as I mentioned in my speech, that it was one of the person was Dr. K.K. Agarwal. This is found in only 1%, like it's the percentage is found in very less persons, because the reason behind this is because their body cannot produce antibody against the virus to fight against the virus, or they have a weak immune system, or they have any previous serious disease from before. And that is the only reasons when the vaccine in their body does not work. So that is what I wanted to add. Thank you.
I would like to say that vaccine.
Let me pause the discussion.
If vaccines were not.
Let me bring in the medical part of it, so that we can go to another topic. If we had an ideal solution, like if you had an ideal vaccine with no side effects, with 100% prevention, would there be a debate? There wouldn't be a debate. Okay.
Correct.
If I ask you the other way around, if there is a risk of road accidents when you go to school in the physical form, but would you still avoid going to school? See, there would not be a debate. Okay. So when you look at a debate topic, you have to look at perspectives, and you have to weigh the pros and the cons. It is not a complete black and white. And that's the point that I want all of you to understand. And that's the reason why this debate was thrown to you. And that's why there are two sides to the coin, and how you look at it in terms of your perspective is what we are really seeking. I think you people did extremely well, but I think that just keep it in mind that there is no ideal solution in most things in life. Okay. Can we have next question?
May I
start?
Manyata, who you're the one? Yeah.
But I have a question.
Jeel. Yes. So one of the opponents said that countries like Sweden and all have not even stopped the schools. Yesterday's report that Sweden, which has not closed schools since so long, is been suffering from a hardcore pandemic. I would also state that, okay, I do agree that the infection rate in children is very less, but don't you think about the adults which are teaching them and the children's family? If one student, let's take example of one student, if one student get affected, its family get affected, the teacher get affected. I personally lost my teacher. She was one of my favorite teacher, and suddenly, due to the second wave, we were full careless, and now we cannot afford to be careless. I lost one teacher. Everyone can lose more. The Delta variant is more infectious, and I'm not saying that we should all wait for 2 to 3 years, but 104 crore people have been vaccinated. 138 crore is the population. Please apply the math. It's 34 crore left. According to the speed by which government is vaccinating, in the month of October, it's 23 crore. By November, it will be 30 crore. I can guarantee you that in 3 to 4 months, hopefully the students will also get vaccinated, and we can 100% surely move to the schools back. Why do you want to take risk for just 3 to 4 months when you have spent 20 months staying at home?
Okay.
Sir, may I?
Yes.
Sir, may I? Sakshi Vaswani.
May I?
Sir, Sakshi Vaswani.
Yeah.
Yes.
So, sir, there are some points that I figured out that all the students are speaking. So, first of all, let me give you a disclaimer that I respect all of your points, all of your opinions and views. And see, the first point that I would like to take is that one opponent, I won't take the name, okay? I won't take the name. He said that students aren't, keeping themselves protected, and they are all interacting with each other even when the schools are like offline. So see, हमारे हाथ में होता है how we should prevent ourselves. There are many cases now. Just take don't take the corona case, okay? It's upon us. It's in our hand to protect ourselves. So we shouldn't be like only one state or one school ka hum count kare. In like my personal opinion, my school is following all the protocols, and the students are too following all the protocols. So if you want to save your life, then you will, of course. So it's not about the main point, okay? And the second one, that vaccines are vaccines are like this causing very disorders. So see, with the disorders, it's also causing some advantage. Like in my personal opinion, vaccine people having asthma are cured by taking vaccines because it boosts the immunity. The third point is of mental health.
I think
See, by sitting at home.
No, Sakshi, I think let's stick to 1 or 2 points because we have to give others a chance because, you did speak for 3 minutes, so that's fine. So I think your points are well made. As a medical perspective, let me add to it that, vaccine is not an ideal solution. We have accepted it. Just like, going to school, road traffic accident is also a risk. Number two, that, when you go to school and you are sitting far apart with wearing a mask, are you really going there to kind of gel with each other and go back into the old chatty times that schools were all about? Or is it going to be a kind of a fearful situation in schools if we are going to go back? That I think another factor which probably needed to have come in. And so I think that, some of the issues are very contentious. And the third issue which some of you brought up, but didn't quite nail it, the whole data across the world shows that even if children get infected, the risk of their manifesting COVID or dying due to COVID is quite small compared to adults. Okay. And that's the reason why vaccination started with the older people and it's now percolating down to children. The risk is not so much with children as it is with their parents who might get infected if they get the virus and they go back home. So I think some of those medical issues also need to be factored.
Yes.
But yes, there is no ideal solution. Let's go to the next.
May I ask my question? May I?
Just a minute. Enjoy your turn.
Yes, sir. Sir, someone mentioned that 70% of the population of India has been already vaccinated. But here I see a statistics that 72 crore, that is 52.8% of the population has got the first dose. And fully vaccinated who are considered to be safe from the severeness of COVID are only 23.4%. That is only 32 crores of our population. So, like, the vaccination.
You're basically questioning the numbers and statistics, right?
Yes, sir. Yes.
Okay. And so I'll settle the issue. The actual statistics in terms of double vaccination is what you have said. But also ICMR came out with the data that 90% of the population seem to have antibodies in their blood, be it either due to one single shot or due to subclinical infections. But that's a contentious issue. So, I mean, we'll move away from just the numbers, okay? Because the numbers keep changing every day and it depends on the source that you are tapping. But that's a good point. Let's move to the next person.
So may I ask my question?
And I'm speaking for the motion. And the question I want to ask to the opposition is that one person from the opposition mentioned that how can we take the vaccines when we don't know what is in the vaccine? So I want to ask that whatever medicines you take day to day in your life or whatever vaccines you have taken from the day one of your birth, have you ever tried to check what is in there? Never.
So you're basically questioning the person's, whether he or she has dug a little deep into understanding what the vaccines are made of and what it is, what it contains, and what has been the percentage of immunity or immune response it's generated. Fair enough. Again, an issue of numbers. But obviously, if the whole world is talking about vaccines, they must be helping. In fact, if I may ask a counter question to all of you young people, and anybody who gets it right gets a special 2 marks, I will ask the judges. Can you name one country which actually didn't start vaccinating and they were against vaccines and they continued normal life? And then the outbreak was so bad that their health minister had to resign. If somebody gets that answer right, he gets definitely 2 marks extra. But don't ask your parents in the house because, that's the problem with online classes. You get people to participate at home and feed you. So if anybody gets that answer right, I'll the judges.
I think it was UK, if I'm not wrong.
UK, no.
Was it
Is it Israel?
Sir, was it Sweden, sir? Sweden?
Was it Australia?
Tanzania.
Was one of the first
Tanzania.
to get almost close to 100% dual vaccination. No, you missed that. Sorry, it's a difficult one, but try to read it up. The health minister had to read it. Yeah, let's go. Somebody else. Manyata. Manyata, I think. Arunima.
Sir, I think it was Israel.
1 minute, please. Since you're all speaking at the same time, we can't hear you properly. Suggest one at a time, please.
So the idea of you people joining a Hope platform is that you must learn how to think, to be aware of what is happening internationally, and to be able to develop your thinking process on health and policies in a very mature way. So we'll help you do that. And we want you to be...
The Health Minister of Tanzania resigned last month.
Who?
The Health Minister of Tanzania resigned last month due to the same reason.
You know, it's a poor country. They didn't even have vaccines. So don't blame them for not vaccinating. It's a country who had the luxury, but who thought that their policy was different. Their policy was they thought that let natural infections occur. So we actually get a huge amount of what is called as a herd immunity. Have you heard the term herd immunity? Okay, yes, so sir. That is what was done and it completely misfired. So just read it up and tell me after that on a chat sometime, on a WhatsApp or whatever. Yeah.
1 minute, please, 1 minute. We'll take on the last question now. Okay. After that, 1 minute, please. We'll take on one last question. And after that, judges, please send your tabulation sheets where you've been asked to do. And the rest of you can go on with your discussion and rebuttal, but without any marking system.
Thank you so much.
So just one last question.
Ma'am, my question is to...
I asked Arunima, she's not speaking up. Arunima, you need to unmute.
Yes, sir. Was it the Prime Minister of Israel, if I'm not wrong?
Okay. And let's move to somebody else in that
So
case.
may I ask a question?
Sir, may I?
So may I ask?
No, time is short. So Ansh, your turn.
Yes, sir. Actually, the topic is that sending the student to the school with the vaccination. That I only want to say that every coin have two faces. Looking at one is not a tactful way to deal with anything. We know that vaccine is one thing on which we have to trust and go on. But we have to see the other sides also, as my worthy opponents were with a good cause and said that there are advantages of vaccine. But as you have also said that there are road accidents, we can't stop on going to roads. It is, yes, it is true, but we have to trust also. But there are two sides of the coin and we have to see the other side also. Like 40% of the children in America does not develop the antibodies after getting the COVID-19 during the age of poverty or the adolescent between the age of 12 to 18. There are many changes.
1 minute, Ansh, you're reading, you're not refuting.
Ansh, anyway, the point.
And I think that's it. You carry on with your discussion.
Hear about the rebuttal. Okay.
Ask a question.
Point to ask. Let's.
Sir, may I ask?
1 minute, please. 1 minute, please. Judges, please send in your mark sheets and the rebuttal can continue as you wish.
And ask Ankit, yeah.
Sir, actually, I'd like to answer, not ask a question, but answer a question from Sakshi earlier. Is it fine?
Yeah, it's fine.
Yeah, so she had said that it's each student has to care for their own health and make sure that they don't get affected by the virus. But I would like to say that throughout this entire session, we have continuously heard that students below the age of 17 are not going to get affected. They are not going to die. They are not going to get severe illnesses, which is, I would say, going to their heads. It's creating a belief in them that they are not going to be hurt whatever happens to them. So that is causing the students in many places, might not be in certain schools they might be more responsible, certain schools less. It depends. But why shouldn't we just make sure that the entire situation does not occur by just waiting a few months? That is what I would like to say.
So 2 points. A couple of points to Ankit. Ankit, first and foremost, I think when you spoke second time, I like the way you spoke because you were actually talking quite from your head and you are formulating your thought process pretty well. So keep it up. Okay, the initial setback, forget about it. In future, I will do well.
See, Ankit, now I would like to answer your. Excuse me, Ankit, I would like to answer. See, what I said, you said that my school isn't responsible for all those. See, it's upon school and it's upon students to keep responsibility for that. You have to maintain social distancing. You have to sanitize your hands, and you have to wear a mask. So it's upon us, and it depends, as you said. And it's upon the school to take strict actions. Like my school is saying that if you don't wear a mask, they will fine a charge. So it's upon school how to keep it regulating, and it's upon students how to keep them more responsible. School is the where place, school and home is the places where students learned how to be responsible.
So Sakshi, thanks.
I would like to.
Again, I'll tell you.
I would like to
level of discussion.
I would like to refute.
Not to a squabble. And there's a difference between a squabble and argument and a discussion. Okay, so I would actually encourage those old-fashioned school squabbles. Like you get after a fellow on a minor point and then you haggle and squabble. Let's move a little beyond here. I want to treat all of you with so much respect. Okay, so let's go on to the main issues.
Question to refute.
Yes, I would like.
I would like to refute.
No. I think who's the person who's supposed to mute the person who's in charge? Is it Bindu or yeah? So we want to hear. So the point I want to make during the discussion with Ankit is that life is not black and white. So it is not that one thing is very good and the other is terrible. That children don't die, they do. But if you look at the overall percentage of children who get affected and die, it has been extremely low. Now, low doesn't sanctify or justify a single death in a child. But then, the same applies to road traffic accidents. Don't forget that. So we are at the moment, since we are at a juncture when there is no ideal solution, we are trying to find out what are your perspectives about the way forward. The other part of the topic is equally important. The amount of education loss that has happened in 1.5 years is enormous. And for many of you to get back on track, to be able to pursue careers could be in jeopardy. So it's a question of, trying to balance one against the other. It's not an easy solution. And that's the reason why we kept this debate. Who has not spoken yet? Last person.
I
have.
Himanshu Gupta.
Yeah, Himanshu, your turn then.
Now, I wanted to tell that the vaccination is expected till December, this year's December, and it is told by experts. And we have waited for such a long time, and I can't say that online has been such a fail that we have to immediately open the schools. So can't we wait for just a couple of months and continue our schools after vaccination? That is my question to opposition. Because it would be very unfair that after...
No, I think one person should speak. I think you've been...
Yeah. Can I refute?
Okay, last person.
Please refute.
May I refute?
Yeah, I think for you.
To Himanshu, I would like to answer that till now, 27% of students were not able to attend online classes. And this is not a vague survey. It was done by NCERT itself. And we all know NCERT surveys are quite reliable. So 27% of students were not able to attend online classes for the past 2 years. Is it worth to leave such a huge population of students behind and just focus on privileged students? We must open schools to let all of these people also, take the advantages of education.
I would like
to say, please elaborate on that.
Online education restricts it to only people who have access to electronic devices, smartphone or a laptop or whatever, and or the network connectivity, and depends on with whom you're connecting. And there is always a price to online education. How many of you, by the way, use Byju's? Okay. Now, I just want to tell you that I believe it's probably useful. A lot of people do it, but it comes with a price. And, you have to be sensitive that, education should go to people who may not be able to afford too much of those devices. So, and if all of you would have tried it out, just doing a 2 to 4 hour session with a smartphone is not a very easy thing to do here. I mean, if you have tried it, you would know how difficult it is to keep your attention fixed on a small device when the teacher speaks. So anyway, those are issues. I'm quite happy that Payoja has raised some very important.
May I please?
Just 1 minute. Can we now wind up with regard to the tabulation of marks, and then we will keep the discussion going.
So I have not.
So
Please put forward my point.
Excuse me.
Just a minute. Rajesh wanted to speak, but Rajesh, I don't see your video.
No.
May I ask a question, sir?
1 second, please. Students, just wait. The marks are being tabulated. You carry on your discussion as you were. I think Mr. Oja was in some other meeting and it became, his thing became unmuted at that time. So you carry on. And I mean, I think we could take the feedback from our judges who are here. They can also put in some of their tips and suggestions while we tabulate the marks.
Sure. So we'll have 3 more questions. I can see Meghna waiting. And
please.
So let's take Meghna. Go ahead. You have to be ready to speak. Meghna, are you ready or shall we move to somebody else?
I think she is Anumegha.
Oh, Anumegha. Yeah, I can see half of her name. Yeah, sorry. Go ahead.
Sorry, yes. So I had a question for Mr. Ankit. You mentioned that children will not keep their masks on in a practical scenario. Students in the middle and senior school are matured enough to know the risks that the virus possesses and are responsible. And as for students of junior school, they were born into a world and introduced into a society at the time of this pandemic. They're more adapted to the protocols than anyone else. Another question in general is that many of my fellow students here mentioned that there is no rush to stop online learning and move to offline because it has many risks. Well, there are risks that online learning poses to mental health. We are raising an entire generation of socially maladjusted people who only know their friends from school through a screen. They have no practical experience of learning, of running with students of their age and playing with them in no form of cognitive.
Let's move on to Rajesh, but before that, I must take your point, Anumegha. I think it was a very valid point. I want all of you to give your feedback. Did you like this online debate or do you wish it was an offline physical debate?
Offline, sir.
Offline.
Offline. It was more interactive. Like it was offline.
Sir, I would prefer if it was online because then if it was offline, I would not have gotten a chance to participate.
If it was offline, we wouldn't have met so many friends from across the country.
Exactly, sir.
There are some advantages of both of them. It's a question of how you look at it. So, whether you look at a glass as half full or half empty. So anyway, these are difficult times. Some things are, some things in life, they don't give you a choice. Rajesh, are you interested in asking a question? I thought that you were probably.
I'd actually like to answer the question which was just given by Miss Anumegha.
Rajesh, I have to see your face. We take somebody else's question. Jia and Himali has all spoken. Maitri, I think you haven't spoken, right? Go ahead, Maitri.
So I want to ask that as per my opposition has said that students are mentally affected by the online classes. So how can we by the online classes? So we have to send them to offline class for offline class. But if we see in the offline classes, some of the students have less immunity. So how can we take our risk offline?
Whom are you asking to? I mean,
we have online classes. And so younger children have less immunity and have less maturity. So they cannot understand it how much it's risky and don't take it as much risk. so much serious. So how can we take the risk to send our younger ones to the schools if there is the option of online class?
Yeah, first of all, the school are
May
reopened
I?
for class 9 to class 12 and not for the younger ones. And class 9 to 12 students are mature enough to understand the situation and scenario. And also, I added that it's not about the like they are going online and they are affecting their mental health. I'm not saying that, but just by sitting in a house for 2 years and you haven't gone out for even a day, just think how much mental health will affect.
But
I'm not saying that
Yes.
offline class will not affect them, will take cure them, but at least they will be able to see their school once again, and it will be really interesting to go again after this whole pandemic.
Sakshi, I think that's a very good point. And Jia, your point was also very good. So as I said, human behavior has got a huge amount of variety and variation. Okay, so even adults, they don't behave the way that you expect all of them to do. So there are variations. So I guess the same would apply to children. Sometimes, in fact, children are more compliant. Now, may I go to the judges? Sonali, are you there? Can I see your face? Sonali.
I'm here.
Now we come to basically the judges' comments. What are your views and thoughts and opinions and comments about today's debate, the topic, the performance, and so on and so forth?
Well, first of all, I would like to congratulate all the participants. I think all of them have prepared pretty well, and they have done quite a bit of research and reading to be able to, put forth their views. However, just a few points that I would like to make. One is, whenever you are debating, see, these are debatable topics. That is what Dr. Chaudhary very clearly pointed out when he asked you a question, that how many of you really expressed your views, or you went against your views because you had to express, you got a topic that was against your views. So that clearly showed that it is a debatable topic and there is no one decision that can be taken. But when you are taking a stand, and you need to keep in mind a few things, that is, make eye contact. Some of you have been reading, you have made your notes and you have been reading. That completely defeats the purpose, because the whole idea of a debate is a kind of a dialogue with your teammates. So at that point in time, if you are reading out, then it really defeats the purpose. Secondly, when you are expressing yourself, there should be, whether you are convinced about it or not, since you are talking on a topic, you need to put forth your views very, very convincingly. So you have to gather your thoughts. That is what Arundhati ma'am was constantly telling you all. Gather your thoughts together so that you put across your views convincingly in a way that the other person is convinced about your views. So that is the second thing. Third thing is, I think in some cases, there was a little bit of an aggression when you went into rebutting. And that is something, of course, you should avoid, because this is a healthy discussion. I would, I have learned a lot, because Dr. Chaudhary has really clarified a lot of stuff here, where he has put across a lot of data that has helped us all understand the present day scenario. But I think you children have also done a lot today. So thank you, Dr. Chaudhary, because I think we are better, our knowledge is a lot more than what we had about a couple of hours back. Rest, I think children have done a great job.
The comments of the other two judges as well.
Yes, sure.
Yeah, Ashrita, are you there? Is Ashrita there? Okay. Otherwise, Ivy, are you there?
I think
Yes, I'm
Ivy would
there.
be here, but Ashrita had to leave for another commitment.
Okay.
So maybe she'll come. Ivy is there.
Yes, I'm there. So I would first like to congratulate all the participants. You have done really well. And no matter whatever the outcome is,
It is all about, participating, right? So I agree with Sonali Sen on what she has said. See, it always happens, in online kind of a thing. You are looking at the screen, you are not interacting. I mean, in terms of the eye contact and all. So there is there could be a habit of reading the content. And this is something which is very different when you are doing in an offline thing, where you are making an eye contact and there is more spontaneity there. Whereas in online thing, the spontaneity gets lost, right? So, but there are pros and cons of everything. So perhaps, when you're, doing another activity in some other online thing, you should, take this point into consideration when you're not just reading the content, but you're also, kind of trying to make a point by explaining the point. Of course, there is the constraint of time, but still, you should try and do that, right? Of course, the points that you have made, some of the points were very much, good enough. And we have also learned a lot. And you have not only brought in, some of the national experiences, but also brought in points from the international, forum as well. So, everything was very good. But I think, efforts could have been slightly better. But yes, for adults also, it goes in the same way. When you're taking all online classes, there is a difference in which you interact. I have been always interacting largely with the university students, and with the school students, it's very little, except for my son, who is also in the same age group. But I must say that today's, children, they have so much of confidence, they have so much of, enthusiasm, which I must really appreciate. So thank you, Hope Foundation, for giving me this opportunity to view the debate, and congratulations, all of you.
Thank you so much, both of you. I'm sorry, Ashrita is not there. So we'll wait for your judgments, the tabulation and all that. In the meantime, I just want to ask all the students, see, this was not actually meant to be just a competition. It was actually meant to be an exchange of thoughts and ideas and a learning platform. Okay. How many of you felt that you will go back wiser, having learned something? Very good. So few hands. And the learning process is not, I'm quite happy that many of you actually did a lot of research which enhanced your own understanding and learning. And then you heard other points of view. So you would be tweaking it in your mind. So you would actually become a better person, more knowledgeable person. What I would like to call as health ambassadors for the society. Okay. So both for your family as well as your community and so on and so forth. So we would like to see you do that. Okay. Very nice. The second thing is that, just like online classes, online debates are a new thing. So this gives you a platform to practice and to become very good online experts in a way. So I guess all of you at some point in time would be thinking of giving TED Talks and, talks which would be broadcast online everywhere. So it gives you a good platform to at least start practicing. And the third, I must say that, I was really impressed. Some of you spoke just for 2 to 2.5 minutes, but you could convey your thoughts and ideas so well. And, with simple language and very good convincing arguments backed with some degree of facts. Amazing. I was pretty impressed with the way that many of you performed. So it's always a new place to start and to learn how to perfect the whole art as we go forward. We will be having a whole lot of debates in the future. Remember that the topics are not going to be the usual passe topics. They're going to be controversial topics on health issues. Okay. And we would encourage all of you to keep participating, keep spreading the word around. And in fact, I don't know this time if it was possible, I would urge all of you to ask your friends and school friends and parents and others to also participate as a viewer. Because, if they listen to what is being done on this platform, they'll actually go back as educated people. Okay. So I think that those would be my thoughts. Arundhati, are we through?
Yeah, we are practically through. It's coming just now. We've been doing live streaming on YouTube, so there would be viewers on that. Okay, I'll just get back to you. It is practically done. Just give us 1 or 2 minutes.
Any thoughts from the participants on the format and about Hope Initiative, or about, I mean, not the rebuttal part, but any suggestions that you have for Hope Initiative?
Hello.
Yeah, go ahead.
Yes. So actually, I'm very obliged that Hope Initiative have kept a debate competition, and because debates are a basic thing to clear your minds. Like one side of the glass, but you don't know the other side of the glass. It's not just about winning, but it's about knowing that there could be two phases and what two phases they are. And I'm really happy in participating in this event.
Thank you. Pleasure to have you. Good.
So,
Thoughts or suggestions? Yeah.
yes, so first of all, thank you so much for this event, okay? And I'm really very happy to be as a participant in it. Also, I would like to say that please keep updating us more about these competitions, whether it's debate or any other. I will be really happy to participate in other events too.
So, great. Oh, I must tell you, there is we have a website called Hope. Have you been there?
Yes, sir.
So,
Yeah.
hope.org.in, and we have a page on Facebook. So I think the Facebook one gets updated a little faster. And I usually write a health column for the last 12 years in HT City, Hindustan Times. And that I put up on the Facebook every week. So you're most welcome to join in there and just keep updating yourself. Okay?
Yes.
Check the website. You have some blogs on the website as well. I
Sorry?
would like to know, in the website, the Hope Initiative website,
Yeah.
there are blogs as well. I've seen write-ups in the Hope Initiative website.
Yeah.
So are students as well, like, do we also write those, or?
No, if I'll tell you, at least on the social media part of it, it would be very good if you can give very thought-provoking comments, which we would like to post and share. The only problem is that some people misuse a platform, and we just need to be careful, because we don't like controversies. We like controversies on the front of intellect and imagination and health. But some people, if they're given a free chance, they often post things which may be very distasteful. So we just need to be a little careful. But we would really love to have your comments and articles. If you people wish to contribute, we would really love it. In fact, there are 1 or 2 topics on which we could have online essay competitions also. And, I think the whole idea would be not lengthy essays, but maybe just 500-word essays, and, the thought process that goes into defining or giving a perspective to a health problem. I think that could be a very good idea. We will do that. That's a good suggestion. Any other? None? So, Arundhati, over to you. See, whatever be the judgment and the winners and so on and so forth, so far as I'm concerned, I think almost every one of you is a winner, and I obviously don't want to kind of bias anybody, so I won't give my views on who I thought was very impressed with, but quite a few of you. I mean, I actually feel sorry for the judges. If I were a judge, I would have found it very hard to decide whom to give 1 and 2 and 3 and those positions, because each one, many of you actually, were extraordinarily good, very clear in your thought process, your communication, sticking to time and making a point on a very new topic, because I think health is something which is not dealt with in your classes at all, and you have picked it up only ever since the COVID epidemic started.
I would just like to add here, yes, it was really tough, and it was very difficult to decide as to how to put on the points. And I have one suggestion here, maybe because Hope Initiative is doing a lot of good work. There could be some platform in which, university as well as the school students, can interact, with one another, because, that really helps not only during the COVID time, but also in the other spaces as well. So, some initiative you can take where, university and school students and Hope Initiative can,
Seniors,
intersect.
seniors both. I mean, in those who have crossed into the
The
university.
adulthood and the teenagers, in some way they can.
That's a very good idea. In fact, that would be a kind of a peer group, and yet, the peer pressure won't be negative because they won't be able to induct the young guys to smoke, which they do in offline campuses. So, peer pressure has both a positive side and a negative side. So one of the benefits of an online peer interaction is that, you're limited to only the thought process and ideas and suggestions, but not so much into inculcating some of them into other types of habits. At least that was the way it was in our time. So yeah, that's a very good idea, Ivy.
I was saying this because, yesterday I was sharing it with some of my students that, there's a debate competition and I'm invited. So they were saying, oh, we also want to view that and all. So I said, anyway, you can view that on Facebook. Then they were saying that, maybe, some interaction. So I got that idea from them.
Wonderful. In fact, we'll probably have a debate for the university and college students also. Maybe make the topic a little more tough and, try to get a little bit more on this issue. And then, we can have a larger audience to actually view that. Yeah. Arundhati, are we through?
Good afternoon, sir.
Good
afternoon, ma'am. I had one thing to mention. That is, I'm really grateful to Hope Initiative for providing such an interactive tool, interactive way, and making us aware about health equity and giving us this platform. I had one suggestion that if Hope Initiative has a student body, then other students, young from junior school and senior school, will be able to relate to them, and these student bodies can have their own campaigns, and so they'll be able to reach out to other students at a more close level. So that was one suggestion. Apart from that, I'm really proud of being part of this debate. Pardon, sir.
Which school?
Very sorry. I'm from Delhi Public School, Newtown.
Okay, so why don't you become the first health ambassador or health champion of your school? We'll help you. I'll tell you what, we did that in Lucknow for a long time, including the school where Ashrita's mother was the principal. And it's, by the way, one of the best schools in the country. I'm not saying it because it was the first school where we started. If you see the stats, it produces the best people, and yet it is not from one of the big metros. Okay, so I'm proud of that school. And we started this called a kind of a health leadership program. And, you need one person to act as a catalyst to be able to discuss and, get other people to think on certain topics. It doesn't really, there are different types of minds. So when you're dealing with mid-school and small children, the level of discussion and what inputs you give them has to be completely different. But how you do it is also a knack. So when I do a book, for health book for children, I have to decide, is it going to be for high school children or for small kid children? So for small children in junior schools, it has to be more cartoon based, more like what would mommy say, that kind of a stuff. But it's important because everybody's mind doesn't develop at the same level. But I think you people should be able to play a leadership role. I really absolutely would endorse it. And please just get in touch with us. We would like to have you do that for your school, and any one of you interested, please do write in and we'll give you all the support that you require. Okay?
Thank you, sir. Thank you.
Results have come in. We've had a lot of problem with connectivity and judges' decisions and all. So while the state winners are yet coming in one at a time, I'll just declare the national winners. So we have the third prize goes to Ruman Habib. Please show your cheer.
Thank you so much, ma'am.
The second prize goes to Himali Das. And the first prize or the winner of the day is Jheel Jain. That goes for the national winners. Now we are coming to the regional winners. From West Bengal, we have Srinjoy Datta. From Haryana, we have Sheetal. From Goa, we have Ankit Cherian. From Punjab, we have Simon Sharma. And the rest, please, because we've had a huge number of participation from, I think, Uttar Pradesh and others are left. I'll just get back to you. So congratulations, all of you. You've done very well. And just give me a moment. I'll get back to you with the other states too.
Thank you, ma'am.
Thank you. Big applause to all of you.
I think a big congratulations to all the participants, irrespective of whether you've got a position or not, but it takes a lot of courage to speak in front of everybody and expressing yourself. So congratulations to the winners, definitely, and to all of you. And Dr. Chaudhary, I will definitely consult with Anumegha and Srinjoy and Anurima Dev. Anumegha and Anurima Dev, Anumegha, in fact, right now is a student leader as well. So they do a lot of interaction with the juniors. They go into the classroom and they do a lot of peer interaction. So I think we could have health as one of the topics for them to discuss in the classrooms.
Great.
We will get that done.
Wonderful. Okay. Shall I log off, Arundhati? It's okay.
I have something else coming up at 2 o'clock.
Thank you very much, Sonali, and anybody else who wants to leave. But it was a pleasure having all of you. And thank you for sharing your Sunday morning time with us. We learned a lot.
It was a pleasure. It was a pleasure. All the best to you, children. All the best to you. And thank you so much, Dr. Chaudhary, for having me here.
Pleasure.
Same here. Thank you very much. And all the best to all the children. They have done very well. Yeah, and congratulations to the winner as well. In fact, everybody is a winner here.
Yeah.
Great.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you, sir.
Thank you.
Thank you, ma'am. Thank you, sir.
No, Arundhati.
Thank you, ma'am.
No, you're mute. You have to unmute.
We are waiting for results of UP and Maharashtra. So just give us a little time. I'll get back to you just now. In the meantime, if others, the judges and Dr. Chaudhary, if you have other commitments, you can proceed.
Thank you so much. Thank you so much. I think it was the Hope team did a very good job. It's very difficult organizing a series of debates like this from state level to, from the three-tier debate. And I think that it was really very well done by the Hope team. Congratulations.
I would wait till the end because there are 2-3 more results which are coming in.
They are coming in. From Rajasthan, it's Ansh Jain. From Uttar Pradesh, it's Mansi Singh. From Assam, it is Yasna. We're still waiting for Maharashtra. I'll repeat it once more.
The only difference that you have in an online and offline thing is that whenever you announce winner, there's a huge applause, That cannot
missing.
happen in
That
online.
is missing. And that's a very big blank.
Yeah.
I think we should play a music or something, next
something
time.
like, cheer up.
We should have some cheer. You're right. Thanks, Ivy. I think I'm going to take it up next time because that is what I'm missing, the excitement which is palpable when.
And also the peer group, cheering up and something like that. And there are other difficulties also because you cannot include a huge audience.
That's true.
That's the difficulty.
Actually, you cannot have a huge audience. And even if you have a big audience, the sense of participation is not there in case of online. Though, of course, see, we've reached out to so many states. It wouldn't be possible in an offline debate because then the expenses involved are huge. Yeah. But this is one of the good things. And again, from Maharashtra, it's Arya Rati. Actually, declaring the regional winners is difficult because we have to compare the marks of all of them. So that makes it difficult. So have we come with all? From West Bengal, it's Srinjoy Datta. From Haryana, it's Sheetal. From Goa, it's Ankit Cherian. For Punjab, it's Simon Sharma. From Rajasthan, Ansh Jain. From UP, Mansi Singh. From Assam, Yasna. From Maharashtra, Arya. Okay, we've announced. Have we covered all the states? If we haven't covered any state, please put up your hand.
No, ma'am, we have covered.
We have. So thank you very, very much. Let's have a good That was excellent. Thank you, Bindu, for your presence of mind. I think so. Next time we should have a 3 cheers also recorded and announced over the thing. Thank you very much.
I will take a leave. Thank you.
Thank you. We all have to take a leave. We've extended a little bit. Thank you very much. Thank you, Ivy, for being here. And many thanks to all.